job in your different spaces. We celebrate you, we welcome you. Thank you very much. Because it is you that really hold the districts stable in terms of our healthcare. We want to welcome all the chief administrative officers. If you are in the room, please stand up. Chief administrative officers, you are very, very, very welcome. Karibu sana. Thank you very much for making time. Would love to welcome all the RDCs and RCCs in the room. Please stand up and we welcome you officially. Thank you very much for coming, all of you. We want to welcome all the development partners in this room. Please stand up in a special way and we welcome you. Karibu sana. Thank you. Thank you very, very much, everyone. Again, I would love to welcome community members in this room. Community members, welcome. Yeah, you're very welcome. And young people, thank you very much, everyone, for coming. So I just wanted to take you through the program real quick, and then we can start. We will be having our introduction. We'll invite just shortly the director of Mbale Regional Referral Hospital, Dr. Stephen Obo, to officially welcome us today. And then we will have the RCC from Mbale, Madam Asumini Nasike will be here to speak to us. We'll also welcome the Lord Mayor of Mbale City, who will speak to us, and then we can have discussions from our partners, and then we will have officials from the Ministry of Health, including, we are privileged to be having the Honorable Minister of Health, Dr. Jane Ruth Acheng, who will be with us. We also want to announce that we will not have Professor Francis Omaswa today. He will be joining us tomorrow, but he has sent Professor Dan Chibule to give us a keynote address. He will be joining us tomorrow, Professor Maswa. After that, we will have a tea break. I think we'll have a working tea, and then we will have an exhibition just outside. If you're part of the exhibitors, I'm sure that your set is ready or your table is ready. We will also be giving out mattresses to Mbale Health Center 4, and that will be presided over by Professor Rhoda Wanyenze, which is really a great thing. We will then have different paper presentations that will then culminate into a plenary session, as well as going into our panel discussion. Then we will have lunch, and then we will come back for the most exciting part of the day, which certainly is the breakaway sessions, where we're going to be having us seated in different groups, deliberating on different issues. Since we are really behind schedule, I want to invite our host, the director of Mbale Regional Referral Hospital, Dr. Stephen Obo, to come and officially welcome us with his opening remarks, and then we start. Dr. Stephen Obo, you are very welcome. Karibu sana. Let's clap for him as he comes. Dr. Obo, you're welcome. You're very welcome.
So good morning, everybody. Yes. Once again, my name is Dr. Stephen Obo, and I'm the Hospital Director of Mbale Regional Referral Hospital. All protocol observed, I would like to welcome you today. I'm aware the minister is around. She's coming in, and maybe we shall redo some of the opening remarks when she's in for her benefit. So all of you guests, you're all welcome today. I would like to welcome you to the first ever health assembly we are holding for the Mbale region. This indeed is a historical occasion because nothing like this has ever been held before in this region. Many other regions have held health assemblies before, but none has been organized in this region. So I would like to thank all of you who have participated for enabling this dream to come true. As many of you are aware, at national level, we do have the annual joint review mission, which is held every year by the Minister of Health. And it is hoped that once the various regions in this country hold their health assemblies, this can help to feed into the joint review mission, which will be held by the Minister of Health in September. It's usually held in September every year. Dear colleagues, our region is indeed a unique region because of its circumstances. First of all, we are not just one region. I think all of you agree with that. We are three regions, not so? Because we have the regions of Bugisu, we have the regions of Bukedi, and we have the region of Sebei. So I don't think there is any other part of this country that is as diverse as we are. We are actually three regions. We are not one region. I think you all agree with that. Secondly, we form the largest catchment area for any region as far as health is concerned, because we are composed of 16 districts and one city. There is no other part of the country that has such a large and diverse collection of districts. We also have the largest population of about 4.5 million people. And also uniquely, it is difficult to get a single name for our region. I think you'll all agree. Because if you go to other places, you'll hear Ankole region, Lango region, West Nile. So getting a single name for our diverse region was a bit of a challenge. And I guess many of you are rightly wondering why we are calling ourselves the Mbale region. Well, we decided to call ourselves the Mbale region because of the fact that we as a regional referral hospital are based in Mbale, and as the mandate of the Minister of Regional Referral Hospitals has been changing, we are now expected to do more than just be a curative center. As you may be aware, the role of the regional referral hospitals has been expanding over time. So now we are not just based to provide curative care, but we're also expected to provide some form of technical oversight, technical support, and supervision to all the health facilities in this region. In time, we hope that the Regional Referral Hospital, working together with our partners, will be able to fit into this role and not just be a standalone curative center in Mbale. So that's why we decided to call this the Mbale Regional Health Assembly, because as a Regional Referral Hospital, we have taken the initiative together with our partners and the various districts in this catchment area to work so that we can bring all of you together here today. So my role here today is basically to talk about why we are calling this health assembly. So as I've already mentioned, this is the first, I would call it the inaugural health assembly for the Mbale region. So this health assembly will provide a platform for all stakeholders from all sectors to take stock of the milestones achieved on the key health performance indicators in the region. It will also enable us to look at our challenges, discuss them, and come up with solutions. I think as many of you in the health sector have realized, we as health workers in this region have been meeting together frequently. But you realize that many of the health challenges in this region cannot just be dealt with by us as health workers. We need the involvement of all the stakeholders. And that's why here today, you see we have people from our partners, we have people from the Ministry of Health, we have people from Ministry of Public Service, Ministry of Local Government, and even locally you have seen we have RDCs, we have the Chief Administrative Officers, we have the cultural leaders, and all other stakeholders from the NGO field, so that we can sit down together and have a candid discussion on what our challenges are. So this health assembly has been jointly convened by the Ministry of Health, Mbale Regional Referral Hospital, the Mbale City and the 16 districts within the regions of Bukedi, Sebei, and Bugisu, of course in collaboration with our implementing partners. So what are the objectives of our Regional Health Assembly? The first objective is to jointly review the annual performance of the regional and the district health sector for the last financial year, that was 2023-24, in context of the health sector strategic plan. We also plan to discuss and propose mitigation measures for the key health sector performance bottlenecks that have been identified in the region. We also hope to share lessons, best practices, and benchmark against the good performing districts. Of course, we also hope to establish networks with other regional partners that are key allies in advocating for better health services in the region. And we also hope to advocate for increased support towards health service delivery in the region. So during this health assembly, what are some of the planned activities that we hope to go through? First of all, we hope to provide an overview of the national health sector performance status against the key performance indicators and targets for the districts. We also hope to present the regional health sector performance status and the statistics for the health indicators in the region. We hope also to present the district health sector performance status for the mid-year 2023-24. We also hope that we shall be able to discuss the key health sector bottlenecks, the gaps we have, and perhaps come up with the recommendations to address those gaps. In addition, during this Regional Health Assembly, we shall have a 2-day exhibition that will be held concurrently throughout the 2 days of the meeting, which will involve some of our partners who work with us, some of our suppliers, etc. We also hope that to award some of the best performers in the region and those who have been contributing to the health system strengthening in the region. So at the end of the day, what will be our expected outputs from the Regional Health Assembly? We hope to have a regional action plan that has been generated to address the challenges that we have identified during this Health Assembly. We hope to formulate an integrated regional health forum and a committee, and we also hope to generate a follow-up plan for the regional team on the actions that have been generated during this Health Assembly. As I end my presentation, I would like to re-emphasize that this is our first Health Assembly in this region. I know it's the first time, so not everything may be perfect, but I pray for your forgiveness and indulgence in advance. We hope that we shall be able to organize the next Health Assembly next year, and hopefully it will be better, and I'm inviting you all in advance. I would like to thank all the people who have made this possible, all our various partners. I may not have the time to name you all, but you know yourselves, and all of you who have organized this function today. And as I end, I'd like to wish you all happy and beneficial deliberations. So God bless you all, and thank you for listening to me, ladies and gentlemen.
Thank you very much, Dr. Bo. Of course, would love to invite the DHO from Mbale, Dr. Jonathan, to as well come and officially welcome us to his district. Dr. Jonathan, you're very welcome. Come and also say a word or two as you welcome us with your opening remarks as well. Dr. Jonathan Karibu, the DHO for Mbale. You're very welcome, sir, to come and officially welcome us. I've also been informed that our dear minister, the Minister of Health, Dr. Jane Ruth Acheng, has arrived, and shortly she will be coming to take her place. And we'll also have another opportunity of sharing very closely with her. You're very welcome, Dr. Jonathan. Please come and officially welcome us to your district. Karibu.
Thank you, Program Manager. I think with the Mbale District is a special one because we have come two people. In here we have Mbale City and the Mbale District. For myself, I'm the City Health Officer. Mbale City, which is a child of Mbale District. I think that's why the presenter was saying the DHO of Mbale District should welcome you. I think by his own voice, let him greet you before I can give the opening remarks.
Dr. Jonathan Wangisi, the District Health Officer for Mbale, the mother of Mbale City. You're all most welcome.
Thank you, my senior brother. I observe all the protocol in the house. Once again, I'm Dr. Moses Mugonyi. In a special way, I take this opportunity to welcome you to Mbale City. Feel at home. This is, I think, the best and the biggest city in the Eastern region where everything happens here. It is a major referral center for health facilities, a major business center, transport hub, and all these factors put us in a special risk as a region. That's why you're hearing a lot of epidemics occurring in Mbale. We are benefiting in terms of business, but on the other side of health, we are having the effects. But nevertheless, we are the team leads, of course, technical team leads with the support of our political and religious and other traditional leaders. We are doing our best such that we don't put our population at risk of these effects of our special condition as a biggest city in Eastern region. I think those are a few remarks. I'll stop there for now. Maybe my brother, Dr. Jonathan, has something more to add on. And in a special way, I welcome you to Mbale City. Enjoy the good amenities in Mbale. Mbale is safe. We have a lot of tourist sites. We have zoos. We have Wanale Mountain where you can enjoy in the evenings after the meeting. And I know by doing so, you'll be contributing positively towards bringing up the well-being of the health of our people. Because when you have something in the pocket, you'll be able to eat well, you'll be able to seek medical services in the best quality facilities available. Thank you once again. Thank you for listening.
These are the people in charge of our health in Mbale City and Mbale District. Thank you very much. We also have the chairperson of DHOs in this region, Dr. Godfrey Mulekwa. Dr. Godfrey Mulekwa, we also want to give you the microphone to as well officially welcome us here with a few remarks. You're very welcome, sir. Karibu.
Thank you, Programmer. The guest of honor, the Honorable Minister of Health, and all of the officials from Ministry of Health, our bosses, the district leaders, we have the RCC, we have the road mayor, the LC5 chairpersons of the 16 districts that form the Mbale region, the chief administrative officers, my colleagues, the DHOs, the implementing partners, development partners, ladies and gentlemen. I want first of all to thank my colleagues, the Mbale City Health Officer and the DHO Mbale District for officially welcoming us to this very important event. Ladies and gentlemen, I think like you realize our region is one of the most organized and coordinated region in a way. Because we are effectively managed under the stewardship of Mbale Regional Hospital, and we are one of the few regions with the most effective and vibrant operational center for emergencies that is able to promptly detect and respond to all forms of emergencies, both infectious and non-infectious. Ladies and gentlemen, I want to take this opportunity on behalf of the district health officers in this region to welcome you to this very important occasion. Indeed, like the director of Mbale Regional Hospital has mentioned, we are really excited that this is the first of its kind. It is a historical moment because this is what has been missing in the occasion, in the equation. As a region, we have actually made strides in the health indicators like you will see later on. And therefore, we want first of all to share this with all of the stakeholders and also really harness some of the support from all of us. Because as you may be aware, health is for everybody. And if we cannot involve everybody, we shall never make strides. So in the interest of time, I want to officially welcome you to this region, and we together share what we have in place as a health system in the region, and also what are some of the gaps that we can fill together as a region. I welcome all of you for God and my country. I'm Dr. Mlekwa Godfrey, the chair of the district health officers in the 16 districts and the one city. Because our region, Mbale region, or Bugisu region, is comprised of 16 districts and one city. It is comprised of 3 sub-regions of Buked, Bugisu, and Sebei. So please enjoy yourselves. Thank you very much.
Thank you very much. I want us to stand and welcome the Honorable Minister of Health, Dr. Jane Ruth Acheng. You're very welcome. Thank you, ma'am, for creating time for us today. And in the same way, let's stay standing to honor our country once again with the national anthem. The technical team, please. Thank you very much. May I invite you to please take your seats. Honorable Minister, we ushered this event before God earlier. Ladies and gentlemen, thank you so much for coming to our very first ever, the Mbale Regional Health Assembly, where we are going to deliberate deeply on service delivery and how we can harness partnerships to build a strong and resilient healthcare system. We want to appreciate the teams that have been behind the organization of this great, incredible assembly. Of course, let's appreciate them with a round of applause. It's been long nights of planning this to have this. In your different capacities, thank you very much for making time to come for the assembly. Since we are running out of time, I want to once again invite the director of Mbale Regional Referral Hospital, Dr. Stephen Obo, to officially come and give his opening remarks, as well as welcome the minister and also lay the ground bare for our conversation. Dr. Stephen Obo, you're very welcome. Karibu.
Yes, thank you very much. It's very rare that you get a chance to have a repeat performance, but you'll bear with me. So, Honorable Minister, all our cultural and traditional leaders present, our religious leaders, the Permanent Secretary and her representative, all the RDCs present, the Mayor of Mbale City, and all the LC5 chairpersons present, all the RDCs present, the Director General representative, representatives from OPM, Minister of Public Service, Minister of Local Government, Minister of Health, all the Chief Administrative Officers present, all our development partners, IPs, and all our invited guests. I take this opportunity once again to welcome you to Mbale for this first ever Regional Health Assembly for this region. As I had already mentioned, this is the first ever health assembly that has been held in this region. So it's indeed a historic occasion for all of us here. A number of regions in this country have already held their health assemblies, but for us, this is the first time. The Ministry of Health usually holds its joint review mission in September of every year, and it is hoped that by having regional health assemblies in every region of this country, this will help to feed into the joint review mission, and as such, this is part of that effort. Dear colleagues, as I already said, our region is a unique region. Indeed, it's not just one region, but it is 3 regions, because it is composed of the regions of Bugisu, Bukedi, and Sebei. In addition, it has the largest number of districts for any catchment area, which is 16 districts and 1 city. And going with that, it also has the largest population of any other region. I already also said that sometimes, because of our diversity, it is very difficult to get one name for this region. Not like other regions, for example, like Lango, Acholi, or even West Nile, for which you can have one name. So rightly, many of you may be wondering why we decided to call ourselves the Mbale region. And as I had already said, this is because As the Regional Referral Hospital, our role has been changing from just being a curative center to being a center that is expected to provide technical support and oversight in this region as far as health services are concerned. And as many of you have been may be aware, the role of the Regional Referral Hospital has been changing. So in future, you can expect us to provide more support supervision, technical support and oversight as part of our mandate. So what is the purpose of holding this Regional Health Assembly? So this inaugural Health Assembly is hoped that it will provide a platform for all the stakeholders from all sectors to take stock of the milestones that we have achieved on key health performance indicators, identify some of the challenges, and come up with the solutions to address many of the challenges that we have identified in the region. As many of you know, as health workers, we often meet and discuss many of the challenges in this region, but we have realized that in order to improve many of the health indicators in the region, we not just need the health workers, we need many other stakeholders. And that is why you have seen we have invited representation from central government ministries, and locally we have also invited the political leadership, we have invited the RDCs, we have also invited the COWs and various administrators in the district in the hope that together we can be able to formulate strategies to address many of the pressing challenges that we face in this region. So this health assembly has been jointly convened by the Ministry of Health, Mbale Regional Referral Hospital, Mbale City and the districts in this region, together with all our implementing partners. And I thank you all for participating. So what are the objectives of our Regional Health Assembly? Our objectives are to jointly review the performance of the regional and district health sector in the past financial year 2023-24 within the context of the health sector strategic plan. We also hope to discuss and propose mitigation measures for the key health sector performance bottlenecks that we have identified. It's also hoped that we shall be able to share lessons, best practices, and benchmark against the good performing districts. We also hope to establish networks with other regional partners that are key allies in advocating for better health services within this region. And also we hope to advocate for increased support towards health service delivery in the region. So what are some of the planned activities? So some of the planned activities include, we hope to provide an overview of the national health sector performance status against key performance indicators and targets for the districts. We also hope to present a regional health sector performance status and also present the district health sector performance status for mid-year 2023-24. We shall also discuss the key health sector bottlenecks and recommendations. In addition, we shall be running a 2-day exhibition to be held concurrently throughout the 2 days of the meeting, and this will include some of the, this exhibition will include some of our partners, the suppliers, and other commercial entities that we work with and who have supported us. We also hope to award prizes to the best contributors to the health system strengthening in the region and also the best performers in this region. So what are the expected outputs from our Regional Health Assembly? We hope to formulate a regional action plan to address the challenges that will have been identified during our engagement. We also hope to formulate an integrated regional health forum stroke committee that will be regularly meeting to address and these challenges that will be identified. And we also hope to generate a follow-up plan for the regional team on actions that have been generated. As I had already mentioned again, this is our first health assembly. So not everything, I agree, will be perfect, but I pray for your forgiveness and indulgence in advance. I'm sure the next health assembly that we hold will be much better, and I invite you all in advance. We hope that this will be an annual event, and we hope to be seeing you every year as we organize it. As I end, I would like to extend my thanks to all our various partners who have made this function possible. I may not be able to mention you here, but you know yourselves, and we're really grateful for your support. Lastly, I wish you all happy and beneficial deliberations. May God bless you all.
Thank you very much, Dr. Obo, for having us in your district. I want to appreciate in a special way our partners, and it's only fair that we recognize them. PEPFAR, Honorable Minister, we've been supported by USID, Baylor College of Medicine, the Uganda Protestant Medical Bureau, Seed Global Health, Housing Finance Bank, Stanbic Bank, Oxfam, Civil Aviation Authority, Accord, Mbale Hospital Association, IRA, which is the Insurance Regulatory Authority, ABORD, UNFPA, the Obulamu, Busitema University, Makerere University Infectious Diseases Institute, Maristops, Nirvana, Crown Beverages, Makerere University College of Health Sciences, Heroes for Gender Transformative Action, Toro Cement, and URC. All this has been made possible by the generosity of our different partners. So let's love on them and appreciate them. We are also streaming online and on YouTube at the Ministry of Health YouTube account. So we'd encourage all of you. We've deposited this link in the different WhatsApp groups for the DHOs. Please share widely so that we also share these deliberations with the people who are not here. We are also on X, formerly Twitter, with the hashtag Mbale Health Assembly. You can as well engage online. We are also on Zoom. We have shared the Zoom link on the DHO platform and other platforms as well. So let's also engage our online audience. We want to now invite the RCC from Mbale City, Madam Asumini Nasike, to come and officially welcome us. Ma'am, very welcome. Let's love on her. She's the president here. You're very welcome, ma'am. Please, karibu.
Thank you, Master of Ceremonies, our guest of honor, the Minister for Health, Dr. Jane Ruth Achen, officials from Office of the Prime Minister, officials from the Ministry of Local Government, the RDCs present here, the LC5s, and the Mayor of Mbale City, the cows, the DHOs and health officers here, our development partners, and religious leaders. Ladies and gentlemen, good morning. My name is Nasike Asmin. I am the RCC of Mbale City. I wish to take this opportunity, Honorable Minister, to welcome you to Mbale City and ask you to feel at home. I want to welcome the audience to Mbale and also ask you to feel at ease. Mbale is a safe city. Honorable Minister, the security situation of Mbale City is calm. A few issues that we have been having are being managed by police, and therefore there is no need of alarm. I want to thank the organizers of this workshop. It is very timely, and it's a very good one, under the theme, harnessing partnerships to build resilient health systems in Eastern Uganda. I know you have been having a number of meetings which were geared towards achieving or having this meeting a success. I want to thank you so much for the endeavors and the time you have put in this health assembly. Honorable Minister, allow me to appreciate the work that our health officers are doing in Mbale Regional Referral Hospital and other health units within the region, that they have done some good work within our communities. Thank you so much, the health officers. And this could not be achieved without your stewardship, Honorable Minister. I want to thank government for enhancing salary for our health officers. Though we are still struggling with the other sector, the arts department, we feel comfortable that the government enhanced the salary for our health officers. Honorable Minister, though we have that in place, plus the environment that the government has provided, I still observe a few challenges, especially in Mbale Regional Referral Hospital. For example, the performance levels. There's a lot of absenteeism of senior staff. Wherever you go to Regional Referral Hospital, you only see junior staff most of the times. What happened to our people? Where are they? We thought that by government enhancing salary, it was a motivation enough for them to enhance on their performances. Honorable Minister, we still have issues of extortion in our referral hospitals. That is masterminded by our own staff, the government officials. These extortions emanate right from the askaris up to higher levels. Recently, we had the health unit monitoring team of State House in Mbale Regional Referral here. And within a day, we arrested 4 people for extortions because we planned it and we had to arrest them. That evil is still within our health sector in Uganda. Matters of integrity. Our people behave like, at times I wondered, because we feel that a health officer should be someone who should be in shoes, empathy should be the first, customer care. The other day, a patient was telling me, Mom, we are here, but as if Mbale Referral Hospital is a death trap for us. That was a very bad statement. We recently had a very ugly scenario in Mbale Regional where a mother lost twins in her womb and she eventually died. That issue is among the issues that rose the health unit monitoring team of State House to come. Actually, they are still around within Mbale Referral here. What went wrong? What can we do as government to ensure that our people are doing what they are meant to do? She was meant to go for an operation, but there was a delay. She died. The twins died in the womb. And worst of it, they didn't operate the twins. She went and she was buried like that with the children in the womb. What an ugly scenario it was. So I want to think that this engagement is going to provide for us a platform to work together and ensure that we enhance on service delivery in Mbale Referral Hospital and also other referrals within the region. Guest of honor, I want to thank the content within this engagement. Once we all come together as partners, once we come together as community, we shall save life. I have always told the health officers that apart from God and maybe Jesus or Allah and Muhammad, the other people who have the mandate to hold on our health are the health workers. So I want to request that you pay the due diligence to our people, the patients. Health is wealth. Once we are healthy, we live in a health environment. With these few remarks, I want to officially welcome you to Mbale City. I am also still new within here. I'm just about 1.5 months within Mbale. I welcome you. The situation is okay. Feel at ease while we discuss. I wish you the very best in this deliberation. Thank you for listening to me.
Thank you very much, Honorable Nasike, the RCC from Mbale City. raised very critical issues, including absenteeism of senior staff, issues of extortion at the regional referral, issues of integrity, issues of customer care, and issues of negligence, even when the salaries of medical workers were increased. We'll take a deep dive on that issue during our plenary session, but thank you so much for raising it. We want to now welcome the Lord Mayor of Mbale City, the Honorable Kasim Namgali. You're very welcome to come and also give us your opening remarks. You're very welcome, Lord Mayor.
Thank you, Master of Programs. Our dear Minister of Health, all our colleagues, guests, allow me to stand on the protocol already read out, and also welcome you all to Mbale City. Also want the same spirit to thank you, the organizers, for the initiative for this assembly in this region. Like you've said, I think it has happened in other areas, but maybe we have not had one in our region. And like you heard what the director of the referral said, that this is one of the biggest referrals having a very wide area. He talks about 3 areas of Bugisebe and Bukedi, but I can also assure you that even Teso sub-region is handled by our referral here. So the number and the population is quite big, but then the facilities are not reflecting the number of people who are being handled at the referral. It's a bit pathetic when you look at the structure that seems to be coming up. It has taken forever. Honorable Minister, doesn't seem to be like there is an urgency to even have that block done, despite the fact that we have a number of our patients who are on the floor. When you visit, you'll see this for yourself. I think we need to not only look at it as one of those big referrals, but there is need for the facilities to be availed for them to be able to handle the population and the community. There is something my RCC has just alluded to, and maybe want to appreciate the government for enhancing the pay for our health workers. I think that was a very good initiative. But like she has pointed out, I think maybe using this assembly and other forums, we need to dig further and find out whether there are other areas that we need to touch for us to get better health services and care at these units. I think 2 weeks or 3, I had one of my counselors who was sick. He got an attack, and we had to rush her there. And I want to thank the team. They really attended to her so well. But as I reached there to check on her, of course, the story I got was not so good, because one of the ladies who was about to give birth was in the neighborhood, and our health workers were there. But then the lady was requested to raise around 250,000 for her to be helped, either to get a cesarean or be helped to deliver. So there was a lot of struggle. Because by the time I reached there, I found the old woman was crying. I think at the time when she has finally raised the money, but at the time he raised the 250, the lady had passed on. So it was so painful that the lady failed to raise 250. Of course, that shows you the level and the person they were being attended to. Because if it were me, the 250 would have come very fast. But the lady who failed to pay the 250 means she was so needy that someone needed to go to the village, possibly dispose something, and raise that money. And at the end of the day, there were cries there. The lady had died, the money seemed useless. and that is the pain. Sometimes good things can turn out to be bad. So that's why I'm saying that as we enhance the salary, maybe that is not the only motivator for the good service in our units. And maybe we divulge into the details as we discuss during this time. But in my view, and as the saying goes, that sometimes it's not only money, but maybe it's beyond that. Maybe the facilities to use, maybe the equipment. There could be something else that also need to address. If we address the enhancement and address those other areas, possibly we'll get the positive results. But otherwise, I think indeed there are a lot of cries when it comes to issues of attention, and more so in our government facilities. A facility like our referral, I think that is where we refer all cases that have failed in other smaller units. But if where they are going, and we sometimes reach there and also fail on whom to blame. Because someone will tell you that we need a glove, someone must go out and buy. Because someone is about to die. And most of these referred cases are from deep rural areas, where we know that their level of financial muscle, we all know it. So I would think that it's a good initiative for us to have this assembly. It's good to have bold and maybe candid discussion on some of the issues, so that at the end of the day, it should be able to enable us improve and close the gaps, just like it has been noted in the objectives of this 2 days discussion. So I want to thank the teams that really made this possible. The other day I was about to visit my director of the referral. We received an ambulance as a city, and we got the keys and maybe the others. But since the day of handover, we've never seen it again. Why? Because I'm told the referral itself didn't have, and therefore they had to grab this one here. So at the city, the centers, Bufumba and all over, are crying. They want service, they want us to help. We can't, because at the end of the day, and we are discussing in the council, we say we are going to disable the referral hospital. When I rushed to my director, commissioner, ambulance, said, but you people in the system, we see that you got what? An ambulance. But that ambulance, as a city, we don't have it. But also we can't disable the referral because they are disabled. So some of these things, I think they are really critical, that we need to look at them. And I'm happy that we have this assembly. If we can have some candid discussion, it will help us improve our health system. So I think for now, allow me to welcome you to Mbale City. My name is Kasim Namgali, the city mayor. Feel at home, and let's have an open discussion that should aim at improving our systems. Thank you, and you're most welcome.
Lord Mayor Kasim, thank you very much. And indeed, we will be having very candid conversations on the issues that you've raised, as well as the RCC raised in the region. I stand here to testify, and I gave my word to the medical team that exhibited great level of professionalism. And I told them, I promised them that everywhere I'll go, I'll testify that in some places, we get very quality health care in government facilities. There may be challenges. I had an opportunity of visiting the dental unit at Mbale Referral Hospital. I arrived there with my wife. We had dental problems. I was welcomed by a person who is just there to welcome people and sit them down. Nothing more, nothing less. Welcome, have a seat. I was then directed to register in the book, which I did. I was told to wait. I queued, and I was taken into this facility with state-of-the-art equipment. I was given the best health care. They operated on us, both me and my wife, after which they directed me to the pharmacy. I went to the pharmacy, they gave me all medicine. And I was looking, and I said, I don't have to pay anything. They said, no, government already paid it for you. Everything was done. I felt like I was in a private facility. How many of you have visited the dental unit at Mulago Hospital? Anyone? Oh, I have one. I hope you received the same treatment, same experience. And I stand here to testify that the dental unit at Mulago Hospital exemplifies, in my view, excellence in public health service delivery. And I encourage, and I promise them, I am at national conferences, international conferences, and I moderate these events everywhere. 2 months ago, I was moderating and officiating at the World Bank conference, and I stood and testified, and there were about 4 people in the room who said, we agree with you. So I encourage any of you, if you ever have a toothache or anything, please try Mulago Hospital Dental Unit. You will have excellence in medical health care. And perhaps those are the things that we will be discussing and benchmarking on. And I know that you as well give the best health care possible. Unfortunately, we will not be having the Director General, Dr. Mwebesa here, but we have Dr. John Baptist Wanyai, who is the Commissioner of Emergency Services, to come and represent him. Dr. John Baptist, you're very welcome. Come and give us opening remarks. As well, you will be inviting the Honorable Minister, Jane Ruth Acheng, to come and also share with us. You're very welcome, Dr. JB Karibu. Let's love on him.
Thank you, our MC, our guest of honor, Honorable Minister, all the representatives of various entities, as already outlined in our protocol by the RCC and the City Mayor. I take this opportunity to thank you so much for taking a decision to have this health assembly. This health assembly, which brings a very important player in the health sector, is very critical, and it helps us to discuss and have a way forward. Honorable Minister, the functionality of the Regional Referral Hospital depends largely on its catchment area. If we do not have general hospitals and health center force fully functional, then we overcongest the regional referral hospital, and therefore when we do that, we create inefficiencies. So as you sit here to deliberate, since you represent various district local government, we should be asking ourselves on whether the health center for near me or the general hospital is fully functional. Again, Honorable Minister, Mbale Hospital, despite of the challenges, and to all of you honorable members in this assembly, this hospital has again persistently performed the best across the country. And we want to appreciate that, I think, for the last over 10 years. So this means we have a challenge. There are very many good things taking place, but there are also bad things. So how do we strike a balance? And we want to appreciate all of you when there are complaints anywhere who come up to assist the hospital to perform better. The HMU, the Wananchi, the RCC, with the health workers, we need all to work together. And we don't need to blame one another. We all must work together to achieve what we need. And Honorable Minister, because of the coverage area of this Mbale Regional Referral Hospital. You have heard of Bukedi, Bugisu, Sebei. It is my appeal, my request to you that what you have been planning for a long time of having a second regional referral hospital in this region, you continue with that struggle so that these over 4.5 million who use this hospital can be divided, and that will help us to decongest. Again, members, I would like us to appreciate the Honorable Minister. Despite of her very busy schedule, she has prioritized this region to come and be with us. Honorable Minister, we are very grateful. And I want you to recall the bad times we have been in, where our Honorable Minister led us and performed excellently, responding to epidemic diseases. Honorable Minister, you would be able to call her at any time, and we want to appreciate that you were available and happened to control the epidemic disease outbreaks in the country. And we want to say, let the authorities that be continue to place you where you are, and you keep serving God to that capacity. With those few remarks on behalf of the Director General, Dr. Henry Mwebesa, I would like to take this opportunity to request you, Honorable Minister, to address your people in Mbale. Thank you so much.
The Commissioner, Emergency Medical Services, who is representing the Director General, representatives from USAID, the Director, Mbale Regional Referral Hospital, members of the academia, the City Resident Commissioner, and other resident district commissioners present, Your Worship, the Mayor, Chief Administrative Officers, District Health Officers, Assistant District Health Officers, representatives of the different religious denominations, representatives of cultural institutions, our development and implementing partners, all healthcare workers from the region, ladies and gentlemen, good morning to you all. It is a great honor for me to be with you at this inaugural Mbale Regional Health Assembly. Allow me to say a big welcome to all of you. And in a special way to extend my gratitude to Mbale Regional Referral Hospital and USAID Uganda Health Activity and all partners who have worked tirelessly to make this event possible. Let's appreciate them. This assembly, under the theme, Harnessing Partnerships to Build Resilient Health Systems in Eastern Uganda, underscores our shared commitment to improving health outcomes in the Bugishu, Bukedi, and Sebei sub-regions. It serves as a vital platform to reflect on our progress, identify gaps in service delivery, and strategize for a future where every individual in eastern Uganda has access to quality health services. Additionally, this forum offers health professionals and stakeholders a valuable opportunity to exchange knowledge, address pressing issues, and propose tailored solutions to the challenges we have. It also provides a platform to share our collective challenges with one another, with our partners, with key institutions represented, and with the people we serve. I therefore want to encourage participants to use this platform to voice the challenges and bottlenecks you face in your work, while also engaging in constructive discussions on solutions. While the country has made commendable strides in bringing services closer to the people, the quality of these services remain a significant challenge. This calls for a shift in focus towards prevention, and prevention. Therefore, let's share knowledge on evidence-based strategies to enhance the quality of health care and service delivery in the region. Improving health services not only elevates the quality of life, but it also boosts productivity, which is essential for economic development. Over the past financial year, we have witnessed substantial progress in several key health indicators. I am sure many of you have read the demographic and health survey, including the census report. With support from the government of Uganda, USAID and other partners, we have strengthened the health systems. And I'm not going to go through that because I'm sure the director has been telling you over and over again some of the gains that we had during the COVID pandemic. Our health systems will never be the same because tangible infrastructure was put in place. We have improved maternal and neonatal services and enhanced the capacity of our health workers, leading to notable improvements in those areas, as well as other family health indicators. These achievements clearly demonstrate that our interventions are producing positive outcomes, although challenges remain. So on behalf of the Ministry of Health, allow me to pledge our continued support to these vital initiatives. Ladies and gentlemen, I would also like to take this opportunity to express our deep appreciation to the NRM government under the capable leadership of His Excellency, the President of the Republic of Uganda, Yoweri Kaguta Museveni, for the unwavering support extended to the Ministry of Health. The ministry remains one of the priority ministries, in spite of the fact that our funding remains small, but it is still a priority ministry. It is through this support and guidance that we have been able to make significant contributions to the development of human capital, which is crucial for the economic advancement of our country, including this region. Despite these accomplishments, we recognize that significant challenges persist. And particularly for the region, the HIV prevalence remains high. Teenage pregnancies continues to burden the region. Maternal and perinatal mortality is still a big hurdle, driven by the complex socioeconomic and cultural factors that require our collective action. So when you hear stories of maternal death and so on, Let's not blame one another. We need to take action together to put an end to that. Our health infrastructure and service delivery systems still demand considerable support and investments to adequately meet the evolving needs of our population. So I would like to emphasize again, this region that we call Mbale, many others are called by the population they serve, Acholi sub-region, Lango, Chigezi, but this region is called Mbale because it is serving 3 regions with 16 districts. And the fact that it remains the best performing region, as you heard from the DG, really means they've come a long way. So we need to appreciate them. All the other regions serve populations between 2.2 to 2.6. This region serves 4.5. And of the 4.5, the biggest population bulge, as you know, from our pyramid is at the base. 0 to 4, 5 to 9, 10 to 14, 15 to 19. So if you look at a region with such a population, are you surprised that we have those challenges? So let's not complain. Let's look for solutions. Mayor, RCC, whoever, let's look for solutions. Let's not begin our assembly with complaints. We begin our assembly with energy and the urge to find solutions. The ministry is very committed to separating the 16 districts. Most regions serve 9 to 10. You have 16. So we have to find a solution. We are committed. We are looking for the resources. We are done with the mapping, which district will go where or which region will go where. We are done. We only need money. And then we shall separate. In the meantime, allow me in a very special way, sincerely from the bottom of my heart, to appreciate Mbale sub-region and all the partners. Many of these regions are running regional health assemblies. DG, I think it is only Mbale that I will go to. The rest will find me in the ministry. Because you are doing a great job. You are doing a great job, and we must appreciate. During the pandemic, this region was heavily burdened. The Regional Referral Hospital paid a heavy debt. And we came here, if many of you will remember, to open an EOC, to set up the systems with all the partners, because we do appreciate the burden that you're facing. I know many people have talked about the challenges in the hospital. Imagine one regional referral hospital serving that huge population with a staffing structure of 350. Surely, don't these health workers get tired? Don't they? I think rather than complain, we should appreciate them. There is nobody who gets fatigued and will continue smiling, but these health workers do. They are not machines. You are not machines. You get fatigued, you continue smiling, and you continue working. So the least we can do is to say thank you. And when something goes wrong, we come together and give support. And what can we do better? And that is why the partners are seriously giving support. So let's appreciate the partners. The essence of today's theme lies in the power of partnerships. And that is why I said, let's appreciate the partners. It is through collective, collaborative efforts between the public and private sectors, development partners, civil society, and communities that we can build stronger and better systems. Allow me at this point to sincerely appreciate the USA government through its development agency, USAID, together with the UN agencies, the Global Fund, as well as all other entities that have been steadfast in their support for improving healthcare in our region over the years. The success stories from our partnership with USAID, including the local maternity and newborn system initiative, are clear evidence of what we can achieve when we work together. We must continue to leverage the expertise and resources of our partners to address the gaps in our health systems. Looking ahead, our focus will be on strengthening these partnerships to ensure sustainable health outcomes. We will continue to leverage the expertise and resources of our partners to address the gaps in our health system. By enhancing local ownership and leadership, we aim to build a health system that is resilient, inclusive, and capable of withstanding future challenges. I urge all stakeholders present today to actively participate in the discussions and activities of this assembly. Let us share our experiences, learn from each other, forge stronger partnerships that will propel us towards our goal of a healthier Eastern Uganda and a healthier population. Your contributions and commitment are invaluable to our success. Before I end, allow me to say something little about the ambulances. I heard his worship saying they are going to deprive the hospital of the ambulances. And I smiled quietly, because you cannot deprive the hospital. In any case, I think very soon the hospital will have a call and dispatch center that will be based within the regional referral. Ambulances are given per region. In this region, you have about 20 ambulances right now, because we give them per constituency, and it is a big region, and we are still continuing to give. Ambulances serve people through a system that is being developed. And the hospital has every authority to withdraw any ambulance should there be any emergency, because it is still the regional referral for the region. So when the director calls for an ambulance from a constituency, please cool down, just release. It is to save lives. Just give. It will come back. They are not taking it forever. They are saving lives. I mean, you think the director is happy to see an ambulance parked there? He doesn't need it parked there. By the time it comes to the regional referral, it is doing work. When he sends it to other places, it is doing work. The challenge with us politicians, we want to see an ambulance parked somewhere and we are just looking at it and telling the population, we have an ambulance. We have an ambulance. Ambulances are meant to carry out services of emergency, and that is why the director withdraws. So if there are any politicians here, if you go back to the guidelines and the ambulance policy, you will see that the director has a lot of authority over the ambulances. So just be aware of that. And please protect our director. Now, I know there has been a lot of talk about the salary enhancement and it not translating to quality health care. True, and we are all aware about it. A survey was already carried out by Ministry of Finance, and it is true. Neither did we expect it to translate into better quality services. Because one, there are many other issues that have not been addressed, including numbers, skills mix, welfare, and others. The environment, the equipment, and so on. And we continue to do this in a phased manner. But surely in this region, my humble appeal is that we address the issue of maternal and neonatal mortality. We must do it. The fertility rate is highest here. The teenage pregnancies are highest in this region. And therefore, it is no surprise that you will continue to have difficulties managing obstetric and gynecological issues. We need to bring on board religious, cultural, and political leaders to understand the dynamics in this region. And I want to appreciate that you have done a thorough analysis and you'll be presenting the annual sector performance report. That performance report is not for Mbale Regional Referral. It is for the region. Because Mbale serves a region. So when we are here in this health assembly, don't read Mbale Regional Referral. Read Mbale Region. Everything is about Mbale Region. So as I conclude, allow me to express my sincere appreciation to everyone that has been involved in organizing this event. Thank you very much. Your dedication and hard work are instrumental in driving our health agenda forward. Allow me also to add my voice to recognize the following entities for their enormous support towards health service delivery within the region. I heard the director saying this will be annual, so I want to thank you in advance so that next year you also give generously. So when I read your name this year, know that next year you must give more money. And I didn't say I didn't use any other words, I said you must give. Because the director will need the money with all the other partners to organize a similar assembly for us to come together. So maybe I will read and then you clap for all of them collectively. I'll start with USAID, Uganda Health Activity, URC, USAID, LPHS, Mbale, USAID, LSDA, USAID, Northeast, OVC activity, USAID, SBCA activity. There are so many. SEED Global Health, Busitema University, UNFPA, AMREF, Japaigo, Stanbic Bank, Housing Finance Bank, Abbott, Maristops, Crown Beverages, Infectious Disease Institute, Heroes for Gender Transformative Action, and Tororo Cement. Let's appreciate them. Finally, let us continue to work together, harnessing our collective strength to build stronger, better, and more resilient systems that will benefit the people of Eastern Uganda for generations to come. I wish you all a very productive and successful health assembly, and it is now my honor and pleasure to declare the inaugural Mbale Regional Health Assembly 2024 officially opened for God and my country.
Another round of applause to the Minister of Health, Dr. Jane Cheng. Thank you very much for the remarks. I was seated with someone there who said, Dr. Cheng has a special calmness, but a special toughness. And he equated you to mercury. You're a liquid metal. Thank you very much for the positive. I love the energy. It's not about complaining, right? I think you come with a breath of fresh air to this discussion, appreciating the medical workers. Can we just clap and love on them for the work that they do every single day? We appreciate you. You're on your feet from morning to evening. And like Dr. Jane Cheng said, we are all humans. When we are stretched to the limit, sometimes we get off, you know, and I'll make reference to the oncologists who are at the Cancer Institute, who I want to appreciate. I mean, every time I get an opportunity, I also appreciate. These days I speak positively about the work that the Ministry of Health is doing. The team at the oncology department at the Cancer Institute are on their feet from morning to evening. Even with the challenges that you mentioned, that they are few, but they are working from morning. I mean, when you talk to them, they say, what can we do? We can't even barely get time to have lunch. The queues are there. They work. They leave office at 10. So when you work like that, and sometimes you get off a bit, I mean, we can just say you're human. But I love that we come to this discussion with positivism, right? And solutions based, which is something that is quite encouraging. Before we can hear from our keynote address, and the keynote address will be given by Professor Dan Chivule. Honorable Minister, I want to appreciate in a special way some people in our presence. The Office of the Prime Minister has been represented by Dr. Ngobi Agre. Dr. Ngobi, stand up, and we appreciate you. Thank you very much for making time. I want to appreciate Dr. Augustine Mwezi from USAID, Uganda Health Activity. Stand up and we clap on you. He's back there trying to make sure everything goes well. We want to appreciate Dr. Immaculate Dumba from USAID. Where are you, doctor? Yes, we appreciate you very much. Thank you very much. Dr. Alex Mugume, Director, LPHS Baylor, Eastern Region. Where are you? Thank you very much, Dr. Alex Mugume. We appreciate you. Dr. Hilary Alima, UPMB. Where are you? Thank you very much for coming. We want to appreciate Dr. Namome Jennifer from Bank of Uganda. Where are you, Doc? Thank you very much, ma'am, for coming. We want to appreciate my very dear friend, Dr. Watiti Stephen, Board Chair of Mbale Regional Referral Hospital. Thank you very much for coming. We want to appreciate the Country Director of AMREF, Dr. Patrick. Where are you, Dr. Patrick? We appreciate you very much. Thank you for coming. We also have Eli Turio, who is from UNFPA Accord. Thank you very much, Eli, for coming. We want to appreciate Dr. Dumba Ahmed from the Uganda Blood Transfusion Services Mbale Regional Blood Bank. Thank you very much for coming. And we want to appreciate all the people in charge of our security. I've been informed that the RPC is here. RPC, where are you? Yes, Afande, thank you very much. We appreciate you as well as the entire team. All right, without any further ado, I want to invite Professor Dan Chivule to come and give us the keynote. Let's love on him as he comes. Professor Dan Chivule, you're very welcome. Karibu.
Thank you so much. our guest of honor, Honorable Minister Jane Acheng, all our invited guests in your respective capacities, good morning. I am Professor Dan Chibule. I am the Dean of the Faculty of Health Sciences, Busitama University. I'm indeed privileged to give a speech on behalf of our able Professor Omaswa, and I'll generally read it as he presented it so that we take lessons. Members, as you're aware, the Ministry of Health, in its effort to improve access as well as quality of health services, has mandated the Mbale Regional Health Services, particularly the referral hospital, to develop plans, implement them, at the same time monitor the health services and report to the Ministry of Health in order to use this data to improve on how we work. This as well to report challenges, like you've already highlighted many challenges, to report challenges and see how we tackle them together. We also expect such a region to conduct reflective sessions such as this, or what we call reflective practice, in order to review our performance. How are we doing? So that we forge a way forward together. Usually hospitals or facilities are clustered together, and as we are here, we are coming from different settings in order to reflect on our performances such that we forge a way forward, the same way Honorable Minister highlighted. This year, our Regional Health Assembly is premised on harnessing partnerships in order to build systems that are resilient, in order to improve our health delivery in Eastern Uganda. Members, harnessing partnerships to build health systems requires all of us, as previously highlighted. We have seen the role of Mbale region, particularly the referral hospital, the complexity, the population served, the catchment area of 4.5 million, the many facilities that are served, the 16 districts, poses a very complex scenario to all of us. And that's why we need to hold hands together in order to tackle this complex mandate that we have. Nevertheless, Mbale region, through the partnerships, as already highlighted, has walked miles. And development partners like USAID, UN have been on board. The situation would have been worse without partners holding hands with regards to healthcare delivery in our region. It has already been painted that this region is one of the best in terms of some health indicators in the country. To mention, the Bugishu region ranked first, as well as the Bukedi region also was 11th. And a number of districts are highlighted. And I think this is something we need to celebrate together as partners. I think we need to celebrate together. It signifies that Mbale region needs to harness, we need to come together. We need to hold hands together, and we see how we leverage on the different expertises that we have. You may be wondering why partnerships. sometimes partnerships are extremely difficult. But in order to sustain an improved healthcare delivery, especially in our complex setting, as already alluded, we are not named by the people we serve. There are different people, cultural settings, political demands are a little bit different. We need to partner in order to sustain our number one position in the country. Why partnerships? The global landscape is changing. I believe you're well aware. Funding is not coming in easily to fund the different projects that we are doing. And that's why we need to partner together within our region in order to be more resilient when we are together. Number two, we need to gain support and collaborate with our local. We need to go local. There is expertise in going local. For example, in Busitama University, sometimes we are hunting for people to help us teach, but they are qualified people in NGOs or in hospitals. The same way we work with Mbale Hospital. And with the communities, they are experts to help us alleviate some of the challenges that we are talking about. Currently, enhancing partnership will really enhance our robust engagements as well as enhance our services. In the context of building partnerships, dear members, many partners, development partners, including USAID, are forging or require us to partner locally. So based on this, there is a need to set an ambitious goal. So as we discussed, let us be ambitious, the same way Honorable Minister highlighted. Let us be ambitious. Let us see opportunities instead of seeing problems. There are a lot of opportunities that we can work together and alleviate the challenges that we are going through. The objective of this meeting has already been highlighted. Allow me to repeat it. We are here to explore and discuss strategies on how to enhance partnerships. There could be challenges, but we are having this strategic initiative to see how we can work together, everyone on board, cultural leaders, political leaders, to see how we can work together. And that's what we expect today, to see how we can work together in order to alleviate the challenges that we have gone through. There are over 300 participants that we expect today. Like the Bible says, 2 is better than 1. I think 300 is also better than 2. The Bible also continues to say from 2, it says, a cord of three strings is not easily broken. It shows some element of resilience. 300 partners together will be more stronger and more resilient in order to address the challenges that we are facing. As I conclude, what do we want to achieve? As we go through these deliberations, what do we want to achieve? To strengthen partnerships, number one. It should be your goal. It should be what you're discussing today. There are many ectopic things that might come through the discussions, but our focus is to strengthen, to foster collaborations between the different institutions, government, NGOs, civil society, university, communities is what we are about today. Because we know together we are stronger. Number two, we want to build resilience health systems to serve our people. We also want to promote sustainability, and that's why we are going local. we believe locally we'll be more resilient and work together. And together we also want to advocate, as we go to the ministry, advocate for policy change, as well as implementation amidst the challenges that we are suffering. We should be also sensitive about the community that we serve. Allow me to conclude by calling you to action. Whatever expertise you have is very important for enhancing the partnerships that are going to be created, or the strategic initiatives regarding partnerships in order to improve health services in our region. I urge you, there are enormous problems, especially being in a third world country. There are enormous problems. But let us see opportunities in these challenges. Let us look at the positive. Like Honorable Minister was emphasizing, solution. We can end the whole year complaining about the challenges that we have, but there is always an opportunity to save a life or to work together. I thank you.
Thank you very much, Professor Dan. I've been informed Professor Maswa will also be joining us tomorrow, and we will be engaging him deeply on this subject during a panel discussion, high level, which happens tomorrow. I've been informed that people are hungry. We are going to go for a break, but perhaps before we do, Dr. Duari, thank you very much for coming. We celebrate you. Thank you for the extra work that you put in the health sector. Let's clap for him. He's now in charge of human resources as a commissioner. Human resource development at the Ministry of Health. And we will be engaging you deeply as well. All right. Before we go for a break, Honorable Minister, I will be inviting you and the team, including DHOs, and the front team here will be, and all of us will be having a tour where we'll be looking at what people will be exhibiting, what they have been doing, as others are also getting a cup of coffee. We're trying to buy time so that we are back for the afternoon session. So, Honorable Minister, I'll invite you and your team, but before we do that, I would love us to have a picture. We're going to be having about 3 sets of pictures. The first picture we'll be having will be on the front here, and then after that we'll have a general one on the stairs because it's quite big for us to fit just outside. The photography team is working back end and they will help as well. So for now, Honorable Minister, I would love to invite you to come up. I hope that is okay. Or if we stand here, the team wanted to capture the Mbale Regional Health Assembly backdrop, and if we stand here, they may not capture it. Stand? Okay, we stand here. Okay. The Honorable Minister has directed that we stand here. So you're very welcome. Dr. Watiti and the entire team. Dr. Dwari, you should come. We're going to have like 3 pictures inside, then we'll have others there. The photography team, please give us some guidance on what works best for you. But Honorable Minister, you're welcome. And Dr. Stephen, Karibu, Dr. Watiti, Dr. Duari. After this first picture, then we'll have a picture with the DHOs, and then a picture with the representative from the development partners. I would request Dr. Andrew, please come and join the picture as well. Dr. Andrew, karibu. Correct. Gender balance. Honorable Minister, this is quite telling that the people in the health sector, in the top positions, are clearly men. Okay, Dr. Andrew, where are you? I would have loved that you joined this picture, please. Kindly requesting, please. Let's have that picture. Very, okay. The camera crews, have you gotten this? The lighting. The technical team, kindly, maybe we can switch off the screen because I think there's a backlight for now. Is that better? Okay, that's better. Thank you. All right. Are we good to go? All right. Honorable Minister, I would love you to stay there. The team can go back, but we now can invite the DHOs, the district health officers, Karibu, the DHOs and the deputy DHOs, please come have a photo moment with the Honorable Minister. The DHOs, Honorable Minister, these are the people who work tirelessly to ensure that the districts that they are coming from, how are we going to manage? Not even a fish eye can finish this. What do we do, guys? Can some people go up, or how do we, can you get that picture? Okay, some people can be in front, others behind. Can we do 2 lines? The photographers can help. Meanwhile, the political wing is coming up next, the cows and the RDCs as well. Good people, the camera teams, can you direct, please? Okay. All right. Thank you very much. Honorable Minister, I'll keep you there as I invite the political heads, the cows, and the RDCs. Karibu, please, let's have a photo with the Honorable Minister as we celebrate the first ever, the inaugural Mbale Regional Health Assembly. The chief administrative officers, the resident commissioners. Let's have a photo moment with the Honorable Minister. Honorable Minister, these are the people who implement the monitoring of effective service delivery. They come and make sure that the medical workers are on duty. They do inspect and make sure things are happening. Thank you very much, our dear political heads, for coming. I now want to invite the development partners, the representative from the development partners, USAID, Accord. Please, Karibu, the people who have supported us, our development partners, PEPFAR, USAID, Baylor, College of Medicine, the Uganda Protestant Medical Bureau, Seed Global, Housing Finance, Stanbic Bank, Oxfam, Civil Aviation, Accord, Mbale Hospital Association, the Insurance Regulatory Authority, UNFPA, Abbott, Obulamu, Busitema University, Makerere University College of Public Health, Infectious Diseases Institute. My goodness. How are we going to manage this long line? Cameraman, can you grab this? Can others be up? They're asking. Yes, others can go up, please. Can the camera people, can others go up? Please help us. Okay. Others, please, can go up. Okay, I'll ask. Okay, that actually is better. Honorable Minister, these are the people who have made this event possible, and they continue to support the health sector performance. We celebrate you. Thank you very much for your generosity. Honorable Minister, I would love now to invite the LC5 chairpersons of the different districts that represent the Mbale region. LC5s, please, Karibu, come and we have a photo moment with the Honorable Minister, the district LC5 chairpersons. The LC5 chairpersons, please have a moment. Honorable Minister, these are the chairpersons who make sure that work is delivered. And you mostly know them. Most of them are your colleagues. You work directly with them. Our dear LC5 chairpersons, thank you very much for the guidance and making sure that we provide great health services to our people. All right. Thank you very much, our dear health, the chairpersons. Honorable Minister, one more from the Health Monitoring Group, the State House Health Monitoring Unit, the team that makes sure that we deliver. Dr. Ayala Stephen, where are you? And the team from the State House Health Monitoring Unit. Dr. Ayala? Okay. Okay. Honorable Minister, please, with your team, I would love to invite you to officiate over the exhibition tour as others go to have their tea break as well. So let's go for a tea break, and also you can join the Honorable Minister on the exhibition tours. You're very welcome, Honorable. Karibu sana. Can the back-end team help guide the Minister? Moses, please help the Minister. Moses is right there. Director Duari, you're welcome. Karibu. We celebrate you. Thank you very much for coming. Yeah, but after the exhibition. Can we go for a short break? The rest of us, there's tea which has been served. Let's grab a cup of coffee and we will be back. Just to remind you, we are streaming online on the Ministry of Health website. Karibu sana, welcome. Beatrice. We're going to get into some paper presentation where we'll get to hear from different presenters. Each presenter will be given 10 minutes to make their presentation, after which we will have a panel discussion which I will host. So I'd love to hand over the microphone to Dr. Imelda Tumhaire to facilitate the next session. Dr. Imelda Tumhaire, you're very welcome. We will be hearing different paper presentations, including one on the performance of hubs and spoke, the experience sharing with sharing what works and best practices to improve regional picture, identifying any gaps. Dr. Imelda, I want to hand over the microphone to you. No, you'll be talking from here, so you invite these people. I don't know if they have briefed you. Each of them have 10 minutes. Yeah, you can sit there. Or you can sit right here, but they will present from here. You're welcome.
Good afternoon, ladies and gentlemen. We are going into the next session, and the next session has 4 presenters, each with 10 minutes. The first presentation is going to be performance of hub and spoke, experience sharing, what works and best practices to improve the regional picture, any gaps. And this presentation is going to be presented by Dr. Robert Maiteki. Dr. Robert Maiteki is our first presenter. He's from Mbale Regional Referral. He's Community Health Department. He's a public health specialist in maternal child health. He's an intermediate epidemiologist with passion in disease epidemics and calamity response. He's also an advocate for tobacco control under FCTC framework. Dr. Maiteki, you are welcome to address the Health Assembly.
So, colleagues, thank you for coming. Honorable Minister DG, RCC, RDC's Director, Commissioners, Implementation implementing partners, and respective guests in your respective capacity. Let me take this opportunity once again to welcome you to Mbale, the Mbale Assembly. Thank you for coming. My name is Robert Maiteki, and I take charge of the Community Health Department, but I also, Honorable Minister, I also supervise the first Model Emergency Operations Center establishment. You are most welcome. So very quickly, this is our presentation outline. We will be speaking through the experiences that the Hub and Spoke has gone through. We will be looking at the implementation mechanism, what has worked, a few challenges, and a few of our asks. So quickly, this is our entire region. Colleagues, we have 16 districts and 1 city. That's our population. And in the hub and spoke mechanism, as you are aware, our mandate is to extend capacity building to the district general hospitals, but also the health center force. Our assumptions are that after capacity building is done at that level, or those levels, we expect that you propel this capacity down to the health center 3s, health center 2s, and the community. We ride, one of the other areas we want to point out is that we have the border points of entry that are critical to us. You know that under the EOC, the epidemic response, detection and response is critical to us. The border point movement are critical to us, and that's one of the areas we have taken concern. So we have areas like Malaba, Luakaka, Busia, and Swamp. And of course, the hub and spoke again rides on the establishment of the regional mechanism under the support supervision. So how do we implement this mechanism? Very quickly, Honorable Minister, what we do is we conduct review for the previous reports. We go through the previous reports for us to make arrangements for the next quarter. We also go through the DHIS2 to align our priorities in terms of the key performance indicators. And finally, we have a good collaboration now with the district teams. At this juncture, I think I would also wish to thank the district teams, especially the district health officers that have continually strengthened the collaboration. Maybe we applaud the DHOs for this as a region. So very quickly, before we go to the field, we conduct a pre-supervision meeting, which brings on board all the entities. Honorable Minister, in this region, we have continuously started getting a database of competent people in different areas: TB, nutrition, HIV, maternal neonatal child health, not only in Mbale Regional Referral and the districts, but also the institutions, the universities that we have now, the implementing partners are on board. So we have a pool, and we continue to harness more achievements with that pool. Because as you know, the health facilities have different challenges. So whenever we have prioritized the health facilities, we know that this mentor has this competence and is going on this day and will go to this facility. The other thing is we draw the schedules and share the schedules earlier. This helps us to prevent the mentors who may have other commitments. So when we share this and the mentor calls back, gives us feedback, that may not be able to go, we usually shift that. And we are very quick to swap the mentor. So the other area, in terms of implementation, Honorable Minister and guests, is simulation exercises that we have conducted in different fields, not only in neonatal areas, but also the current IDSR, epidemic response, throughout the districts. I'm sure that the districts have benefited in this exercise of simulation for epidemic response, but also the other aspects of nutrition, maternal-child health. But also critical is the logistics. We have developed this character of making sure we understand the logistic picture across the region so that we can have an inter-district collaboration where we think there's a problem of logistics, including vaccines and a few others, registers and guidelines. We shift during the time when the teams are going to the field. They are able to carry along with these items. So we want to see what probably has worked through the time. I know that a number of things have worked, but like my chair, we have always shared, we may not have all this discussion. In this presentation, we have teased out a few areas of discussion, and I'm aware in the program, the different thematic areas under the hub and spoke will expand the other areas of maternal neonatal. They will also expand nutrition. I've seen TB and HIV under the quality improvement presentations. So very quickly here, we have really seen tremendous reduction in the preparation of our hub samples. The laboratory arm has worked very, very seriously to ensure that the facilities are maintained, especially the challenge we had on dry blood sample preparation. We had that, and you know that is critical for viral load, it is critical for sickle cell, and a few other areas. So I'm happy to report that, like we have run through the years, the turnaround time, for example, was 30 days. And you're aware that we work with laboratories outside this region. But, Honorable Minister, just last week, when we were doing our final bits of the report, we interacted with the laboratory thematic arm lead. And he told us from the reports that came in, we confirmed, actually 11 days are the maximum days now that results can trickle back. In fact, the lowest limit here is 6 days. I was very happy with this. But also, the hub transport has improved. Initially, Honorable Minister, we had only 2 hub riders with 2 motorcycles. But we have collaborated with the director of the hospital. In fact, as community health, we had released the motorcycle we're using for the laboratory team to add on to the extra 2. That makes it 4 riders with 4 motorcycles now. And that has helped us. The other thing, very quickly, before we leave this, is the partner collaborations, the district collaborations, and the region. Not forgetting the national team. This link has helped us to quickly plan together, quickly address immediate challenges, and a few others. This has improved because, Honorable Minister, we used to plan alone. In the region, we have now a habit of making sure we prioritize our problems and we're able to sit as a team and we plan together. So like I said, the maternal and child health thematic head will really expand on those entities. But for now, we thought we would appreciate the districts. especially the medical officers that have been able to be mentored, both at the regional referral, but also follow up in the health facilities. Across, on your right, you appreciate that we have a linear growth of cesarean sections now that have been conducted. And I know that there are a few challenges. For example, maybe Tororo General Hospital, because of the anesthetic areas. But I know that this will continue improving. But also that said, Honorable Minister, the left graph shows you that we have also filtered the health facilities that have remained below the key performance indicators over this period, throughout the quarters. And I wanted to appreciate the director of Mbale Regional Referral and the team. In this quarter, we have convinced the director and the team to help us reach these facilities at the facility level with the aim of reaching out through the HUMIC, the political leaders who are here. Key informants, we need to sit down because, again, we cannot be here and say we are going to have quarter in, quarter out, quarter in, quarter out when the performances are not coming through. We think we need to have a sit-down discussion, and as team, I'm sure we will be coming out with some solutions. So, very quickly, this is also another area that Hub and Spoke has been able to do. During our supervision, we are able to unveil some of the critical areas. Just like you can see on my right, the human resource issues in the region. Honorable Minister, you can see all these, when we did the first round of the supervision in 2022, 2023, all these facilities that we visited, you can just see that MASAF stood out above the ceiling of 75% in human resource. But critical, we teased out the anesthetic arm, because again, we had a lot of referrals to the region, we had a number of challenges under maternal neonatal health, and this picture came out. I want to interest you to Kaproron, for example. Kaproron is the only health center in Convened district, and it doesn't have an anesthetic officer. This facility will only rely on Kapchorwa Hospital, which is another district. So, colleagues, I'm also happy that, Honorable Minister, this information was disseminated in the regional QI in Soroti to the district teams and the partners. But I'm happy also to say that USAID, UHA, please, an applaud to that team. They have since helped Palisa, Sironko, and Buko. They have since helped Palisa, Sironko, and Buko, as you can see. This is a good initiative from the partners. I know that there's an issue of wage and what comes with it, but I know that the district that we will continue looking at the advances. We want to quickly look at the challenges. One of the problems that we have, Honorable Minister and colleagues, is the follow-up corrective actions that I've said, but I'm also happy that the director is taking this up at the regional hospital. They have committed to push the critical 6 facilities, and that's good for us. Competing activities for the teams, like I said, inadequate fuel, gears, and a number of them. Our asks, Honorable Minister, that area of implementation and budgeting in terms of follow-up should really be looked at. We need to move as a region. We don't want to move as a regional referral hospital. So I think when we follow up some of these spots, we are able to pull up. Joint planning, I've just spoken about this. Political will, please, the political team that are here and the HUMIC members, let's be engaged. We are going to start doing this with the critical health facilities. We want this to continue. When we leave the facility, we want you to continue to sustain our support and discussion. Transport is one area, Honorable Minister. As you are aware, the EOC in Mbale is being hosted by TASO, but I'm happy that the Commissioner for Emergencies is here. We're requesting that the emergency call block that is being constructed at the regional referral now find space to host the Emergency Operations Center. The Mbale Emergency Operations Center has been remarkable, and a number of regions have come to our place to benchmark on our work, and we think we should be able to move at the same pace. Coordination, we spoke about it. So what's our take home? Hub and spoke is workable as long as we work as a team. Partner support is key, like we have highlighted. Communication, planning together in terms of plans and budget is also key. And teamwork as team of Mbale Regional Referral is also key. Ladies and gentlemen, I want to thank you.
Thank you very much, Dr. Maiteki. I pray that our next presenters, we shall take time to see that we do our presentation within the allotted time. One thing that I have picked is a decrease in turnaround time. A decrease in turnaround time is a quality indicator. It means that our patients are going to be treated in time. And that is something which is very good, which I have noted. Honorable Minister, there has been a slight change in the way we had arranged it. And I would request the Master of Ceremony to come and tell us that change. Thank you.
Dear delegates, we have made a slight change in the program. We will be having more presenters shortly, but we thought that we could have a panel discussion real quick, and then we can get back into the presentation of papers. We'll make sure that this is as brief as possible so that we can jump right into the other paper presenters. Apologies to the presenters for the slight change in program. We're going to have our panel discussion, and allow me to invite my panelists this afternoon. Dr. Alfred Duale, please karibu. I hope you can be supported to have your seat there. Dr. Alfred Duale is a Commissioner of Health Services, Institutions, and Human Resource Development at the Ministry of Health. In his role, he oversees the development of a competent healthcare workforce to provide equitable access to quality healthcare in Uganda. Dr. Duale, thank you very much for accepting to be on the panel. May I also invite Dr. Richard Mugahi. Dr. Richard Mugahi is the Commissioner for Reproductive and Infant Health at the Ministry of Health, where, of course, he leads efforts to enhance maternal, newborn, and child health outcomes. Dr. Mugahi, you're very, very welcome. I also have the honor of inviting Dr. Augustine Muhwezi. Dr. Augustine Muhwezi is a highly experienced public health specialist leading the USAID Uganda Health Activity as Chief of Party. He comes on board with a strong background in health system strengthening, program management, and implementation of health initiatives. I'm also privileged to be inviting Dr. Siraj Masai. Dr. Siraj Masai is the District Health Officer for Kapchora District. In his role, he is responsible for overseeing and managing health services across the district, ensuring the delivery of quality healthcare to the community. Dr. Siraj Masai, you are very welcome. You'll allow me also take my seat real quick. All right, thank you very much everyone for making time. Perhaps, let me start with Dr. Masai here, firstly. You are on the ground in Kapchora. You supervise different health centers and hospitals there. You have been in the health sector for quite a while. Discuss with me the challenges and perhaps suggest some solutions to those challenges in terms of providing better health care for our people in Uganda. Let me start with you.
Okay. Thank you, the moderator, Solomon. I want to observe the protocol, the Minister of Health, Dr. Ruth Acheng, and all other stakeholders during this Regional Health Assembly in Mbale. You are most welcome. Yes, I will start with a simple issue. Health is wide. It's a robust area that involves many stakeholders. So it may not be me alone as a DHO, neither the health sector. We tend to incorporate colleagues from different sectors, departments, ministries, and agencies. So at the end, it is all about multi-sectoral collaboration that we tend to address the issues in the health sector. Yes, I want to applaud government of Uganda, which works through Ministry of Health and partners in ensuring that our communities receives quality health services, and specifically in this case, we adopted a decentralized model or structure in the health programming, where the districts where I sit usually plans, budgets, and ensures the implementation of the programs moves on well. In this case, the budgeting part of it is a mandate of the DHO. Planning, budgeting, HR, supervision, monitoring, and others. However, specifically, I will narrow down to the activities that we must ensure that we achieve. As a health sector, we have almost 5 pillars. One of it is health promotion, disease prevention, curative arm, rehabilitative and palliative care. Unfortunately, most of our focus tends to be curative. Most of our focus tends to be curative. And this is where, Solomon, the biggest animal comes in. Curative means I'm able to receive someone who is already converted. If you're a religious person, you have already accepted that Almighty God is there. And that's why you come to the facility. But the majority of the other pillars are less attended to or addressed. I want to say, I applaud our minister who already mentioned in the morning that our focus now is disease, is health promotion and disease prevention. Majority of our disease burden that we register in the country is around 70 to 80%. So if we are able to strengthen these first two pillars, health promotion, hand washing, cleaning the homesteads, ensuring that people sleep and feed healthy, we reduce many diseases. The same to hand wash, HIV infections, road traffic accidents, immunization, and others. We would have reduced a tremendous, significant number of patients visiting us before we cross the curative part. So I want to applaud everyone who has made here. In the presence of our minister, I want to say, let's walk the talk. When we say health promotion and disease prevention, let it be. That will be the focus, Honorable Minister and colleagues from the Ministry of Health, partners and others. Otherwise, if we dwell more in budgeting, I want to say the biggest challenge, one, will be stockouts of medicines. At Mbale Referral, they will tell you there was no gloves. They will tell you there was no anesthetic drugs. They will tell you staffs are few because you have not recruited enough. You saw the staffing level, anesthetic and others. They will tell you people are no more information. That's health education and other programming, which needs money. Everything is monetarized. They will tell you equipments are down. Equipments are not adequate. So, but majority of these clients, majority of these patients, if we had put all arms and enhanced our health promotion strategies, which I expect after this panel, to come out clearly, and our partners at ministry should be redirected into addressing this arm. I want to say we would have scaled down the burden of disease and would have reduced the cost to benefit those who are in dire need, like someone who needs renal dialysis. At Mbale here we are. Solomon, I didn't address to you. I happen to be privileged among my colleagues that Honorable Minister appointed me as ex-officio. So sometimes I sit at the board of Mbale Referral, and I see the dilemma the referral goes through. However much we pour their money, we can never address it all. For this year, Minister, I want to applaud that you added Mbale Referral another 1 billion on top of last year. But this amount is just to 50% almost of the entire medicines and supplies budget. So what am I trying to say? We need at this level to think of things that can, in general, reduce enormously the burden of disease and cost to the health sector. Thank you.
Thanks a lot. Thanks. From as little things as sleeping in a mosquito net, right? I think the Ministry of Health has done amazingly well with the mosquito net distribution across the country. And I was looking at the numbers that it has contributed to a reduction of malaria significantly. So thank you for that. I'll come back to you. Yeah. Before, perhaps let me go to Dr. Alfred. Dr. Alfred, would love to hear from you. You sit at a very pivotal point at the Ministry of Health right now, where you oversee human resources there. So would love to hear from you about the key challenges in health service delivery and maybe the potential solutions that you can suggest to improve access to better health care for Ugandans.
Thank you, Solomon. Thank you, Honorable Minister. The challenges in health service delivery from where I stand is the fact that healthcare is labor intensive. I'm hearing an echo and I'm very uncomfortable. Healthcare is labor intensive. So you need to have the numbers, you need to have the skills mix, you need to have the right attitude, adequate facilitation of those teams to deliver. Now, in line with our partnerships, which we, can I shift to another? When you hear your own voice, it sounds ghostly. Yeah. So the theme of this meeting actually addresses exactly what needs to be done, because the scope of health service delivery is so broad, ranging from disease, health promotion, disease prevention, treatment, palliation. That whole chain must be manned by people. And as I had said, you need the skills, you need the numbers, and you also need the partnerships. In this meeting, I see the risk of limiting health to the health sector, to the Ministry of Health actors. Health promotion actors are outside the Ministry of Health docket. So the infrastructure for delivery of health promotion, those are actions against determinants of health. They are outside there. Water is provided by a different ministry. Food is provided by a different ministry. Social dynamics, road safety, these are outside, but they will impact us. So the partnerships beyond health is what we need to harness. Where are the sub-counties, for example? I took a deliberate effort. I go to a sub-county and I ask what the social services committee minutes look like. Honorable Minister, is very interesting. The committees in sub-counties, when they're discussing health, they are not discussing how to improve people's health and to prevent disease. They are complaining. Leaders gather to complain. The health facilities bushy, health workers are rude. But the real issues to discuss is, are our people cultivating enough food to eat? It determines health. Are our children going to school? It determines maternal mortality, infant mortality. So the actions which are outside is what we are not focusing on. Now, the other challenge I want to touch on is the issue of partnerships. If we want to improve the regional health system, we need to do a clear strategy for partnerships. For example, where is the private sector in our engagement? I got a shock when I went to Ginger. Ginger has 130, Ginger City, 130 health facilities. Those that belong to government were 20. The 110 were private. But when we start initiatives, either as ministry or as the regional hub, we focus on the 20. The private sector is a key partner and which we need to focus. Therefore, we need to work as a solution on accreditation mechanisms to ensure that what a private facility says is malaria, is guinea worm, is guinea worm. And we also need to harmonize our information systems so that we regulate the sector. Finally, in line with the theme, we have talked about resilient health systems. Where do health systems borrow their resilience from? Resilience comes from three tenets, which also in our regional arrangement we need to focus on. Number one, policies, strategies, guidelines, standards. We are very good at that. We have them. The second are the structures we use. We run a decentralized system. How far do we use that system up to the community level? And I think the structure, Serwanja, I've been around for some time, and I've also visited a number of countries. I'm yet to find a country with a system like ours. If you look at the design of the health system, the decentralized system, this is one of the strongest. And that's why we beat epidemics without taking it to neighbors. We are very strong there. We have a very strong structure, very strong system. Now let me touch on the last part. The last tenet of resilience comes from behavior of actors. Are we together? Behavior of actors is about the incentives health workers or healthcare managers or the communities, the behavior they have in terms of seeking care and also in terms of providing care. That is it. So I want to end on this note that for our healthcare system to be resilient, there are some things which we need to do. And as a ministry, we are redefining, the word is redefining. We are redefining service standards for healthcare workers. What is expected of you? For example, you are supposed to work a minimum of 40 hours in a week. How much of that are you using? You are supposed to keep the facility open. By the way, OPD doors are not supposed to be closed. I don't know whether we know that. OPD doors and police stations, those are two houses whose doors should not be closed. So, do we close OPD doors or not? And when we open at 8, when do we leave? Or when do we open and when do we leave? Those are now the behavior aspects which our health system now needs to pay attention to. If you have a fridge, for example, now let me go back to my home. If you have a fridge, do communities know that anytime they go there for immunization, they will get their child vaccinated? If the answer is no, then that behavior needs to be managed until you are sure why it is the way it is. So as far as I see, the human resource issues are now shifting. We will leave the number issues for the minister and the permanent secretary because they have to mobilize resources. But at the technical level, influencing the behavior of actors to get the best out of what we have, not complaining, is the direction we need to take. Thank you.
Wow. Thank you very much. We have the system. We have to then incentivize the people to change behavior so that they can deliver. You know, we were all impressed when government increased salaries for medical workers. And like the minister said, we wanted that there would be a direct correlation with the service delivery. In your speech, Madam Minister, you said you did not expect that because of other underlying challenges. So as Dr. Druali redefines the standards, I think there are also other underlying challenges that also need to be worked on to incentivize people to work better. But yeah, I will bring it back to the DHO later. But let me bring in Dr. Augustine here. Yours is really to, come in and bridge some of those gaps as a valuable partner. What has been your experience like supporting the resilience of Uganda's health care system? Where have been the gaps and how can we actually close them? You're welcome, Dr. Augustine.
Thank you very much, Solomon. I want to appreciate our Honorable Minister for sparing time to be with us amidst her busy schedule. Honorable, you are welcome, and thank you very much. Colleagues, globally, we know that resources are dwindling. Last year, at the National CHUI Conference, was it last year or this year? But our Honorable Minister informed us that in one of the conferences in West Africa, the donors advised countries with malaria problems sort these problems on their own. We are also witnessing reduced funding for HIV as we move towards epidemic control by 2030. So Ministry of Health alone cannot address all health systems challenges in the country. There is no single partner in this country who can pretend to solve all the problems in the health sector. And the Honorable Minister in her opening remarks emphasized the importance of strategic partnerships in building a resilient health system. And personally, I've actually been part of this process, but working from the other side of implementing partners. So as UHA, just like other partners, we are supporting the government of Uganda to build a strong, sustainable, and resilient health system. We don't implement parallel activities, and we have this partnership at different levels: national, regional, and district level. At national level, we are partnering with almost all departments and in different ways. For instance, we have staff embedded in SCAP department, infrastructure, HR, procurement, call center, legal, everywhere. And the embedded staff are supporting government of Uganda, and in particular Ministry of Health, to build a resilient health system. At regional level, we are partnering with the Regional Referral Hospital very, very closely. In this region, we are working with Mbale Regional Referral Hospital to implement what we refer to as the hub and spoke model. And someone from Community Health Department presented the hub and spoke model. So with funding from USAID, the Regional Referral Hospital is able to provide technical assistance to all the districts, and specifically all health center force, to ensure that they are functional. Our duty is to arrange logistics, because we know resources are not enough. But the Regional Referral Hospital teams take a lead in the implementation of hub and spoke activities. If you don't know, Mbale Regional Referral Hospital has one operating table bed. One for mothers, one. Serving how many? Over 4 million people. So now, my DHO colleagues, if you refer mothers, you refer maybe like 4. All of them are in need of a C-section. And there is only one table. What do you want the Regional Referral Hospital to do? So as UHA, what we've been doing, we've been partnering with the LMNS and also the Regional Referral Hospital to functionalize as many health center force as possible. My colleague here, the DHO for Kapchorwa, he knows what we are doing, and he was actually giving me updates today. We supported Kaserem Health Center with equipment, MCH equipment, and they were able to do the first C-section. And he was telling me now the numbers surpassing 10 every month. There is an accommodation challenge, but at least the doctors who are there are performing C-sections. They are saving mothers, because if you send those mothers to Mbale, they will line up. And when you have an obstructed labor, you don't have time to line up, correct? We did the same to Namatala. Namatala had suspended performing C-sections. They resumed when we provided equipment. Right now, we are also expanding the maternity ward. We are constructing the maternity ward at Namatara. Busiu Health Center 4 also benefited from the MCH equipment. The theater bed was broken. We replaced it with a brand new theater bed and also supplied an assortment of MCH equipment. Now, when the unfortunate incident happened, the one the RCC talked about, even before I got to know, someone sent me an article from Washington. They said, they said, we thought you supplied MCH equipment to Busiu, and we hear this mother has died. They read in an online article. And these are partners we are working with, the global partners, and I had to explain. So in summary, and then we have the PEPFAR partners. We have BERA that is here. We have the OVC. So we combine all resources, leverage on each other's resources, technical expertise, and work with the government institutions to build a resilient health system. Thank you.
Thank you very much. Thank you for supplementing the healthcare system. I was shocked when you said that Mbale Regional Referral Hospital has one such operating table bed for mothers. I'm glad the minister has taken note of that, especially with the population that you are serving. And you talked about maternal health and women who need a C-section. Perhaps that response can be given very well by my very good friend, Dr. Richard Mugahi. Dr. Richard, you're very welcome. We're discussing on the key challenges and suggesting measures to those challenges to better serve our people at a medical front. Would love to hear from you on how maternal and child health services can be made more accessible and effective, especially in rural Uganda or in this eastern part of the country. We were saddened by the story of the mother who died with twins. I'm sure that the Ministry of Health has done a detailed investigation into it. But what can we do better? Where are the challenges and what can we do better? You're welcome, Dr. Mugai.
Thank you, my brother Serwanje. It's good to see you here, Honorable Minister, and all the protocol in the House. I want to appreciate you. I was glad somewhere still doing on issues of maternal health. We handle the highest number of emergencies. Just quickly to respond to your question, we have a number of opportunities, but we also have a number of challenges. One of the opportunities that we have, and this is informed by our statistics, that 75% of our mothers want to deliver closer to their homes. The statistics we have now is that more than 50% of the mothers last year and the previous year delivered from health center 3s, 11% delivered from health center 2s, and around 22% from health center 4s. These are primary health facilities who are headed by our DHOs here. So when you add those three together, it gives you almost 70-something%. So only 25% of the mothers go to general hospitals, regional referrals, and national hospitals. So what this means is that we can actually rethink our system and invest more into the primary health facilities, which are closer, because we know now it's a fact that what kills mothers or what causes the complications is the delay they go through. And I found Augustine talking about that when you refer to Busiu, which I know very well, and Busiu is not able to provide the service, which they should be providing, like we can talk about Nabigando. I told the Elgon group that I'm not happy about Nabigando. I think Nabigando is here. So we must, Nabiganda? Honorable Minister, we are there together. They haven't done much since we left. We shall handle Mpora. So, these issues of having the system blocked or broken at any one level, system at a sub-county level, we must put it there. There's just no way about that. There must be an infrastructure, a human resource, and the equipment, all the needs at sub-county level, that's a health center 3, offering the basic signal functions, which we all know. Then there must be a system at the county level where the sub-counties refer, so that the regional referral is not congested. To be honest, and I've read, well, there is a confidential inquiry going on, and the report is not yet out, but the congestion at Mbale Regional Referral, it's not working as a normal regional referral. The numbers are massive, and when the numbers become big, quality goes down. So we need to enforce, to make sure with all the health leaders who are here, all the other stakeholders who are here, that the region must have the peripheral structures work to do their work, so that Mbale Regional Referral remains a referral in the true name of the referral. Thank you.
Yeah, thanks. Let me just stay with you. Then what do we need to do in the short term, medium term, and in the long term? Dr. Mugahi.
In the short term, and I'm really happy that we have all the leaders here, and without fear of contradiction, we must be practical. The Ministry of Health, in the last couple of years, 2 or 3 years, we have created infrastructure close to 400 health center 3s, more than 400 for health center 3s. In this very region, I think to be exact, should be Tororo. We reached there, there are some infrastructure that has never been opened. There are beds, there are everything, there's everything. And Tororo, please correct me if I'm wrong, but we reached there. And so this is where mothers want to deliver. So the mother coming to congest Mbale, the mother's going to Tororo, and we must be honest about some of these things. So if the blockage is at public service, some of these DHOs here, they have wage, but they've been blocked at public service level, that they need some clearance to recruit. It looks very simple, but very complicated to just get a clearance to recruit health workers from public service. And yet you have the wage. So that seems to be a little bit beyond the DHOs, who are doing a lot of work. And then from our side, as the Department of Maternal and Child Health, who is working with our partners, we have developed a concept of local problems, local solutions, and we call it a local maternity and neonatal system. The purpose of this is to enable a region like Elgon to be able to design their own, to address their own local problems. I want to give one example very quickly. We had 2 anesthetic machines, the machines that are used to give, to make patients sleep. They were in Caproni. Caproni is in Sebei. But one facility along, it's called Atutur. Atutur did not have an anesthetic machine. So we transferred one from the other side. It can also be done even in other logistics, which you have access and one other facility can use. So using that framework to hold each other accountable, but also to utilize the fewer resources that we have optimally, is one of the quick fixes we can do. The resources seem to be around, but we need to have them optimally distributed within all serving Ugandans. Manafa refused to transfer a bed to the other district. And that's the level of honesty we need. Why should an LOC5 or a district leader refuse a bed to be transferred to a neighboring district? A theater bed, yet it's going to save mothers the other side. We are serving Ugandans. For us, at the level of Ministry of Health, we are looking at it from the angle of making sure that resources that are available should serve the entire population of Uganda. In the long term, we need to redesign and have a stronger system focused at community health, take services closer to the people, and be proactive, and even Proactiveness involves the entire package. We call it key family care practices, where you need to have family planning. Then focus on producing the number of babies they can afford. Pregnancy should not be an accident. It should be intentional and planned at family level. But that comes in with a lot of health literacy. Thank you.
I saw Dr. Augustine smiling at you. But thank you very much, Dr. Mugahi. One of the things that I remember, there was a project, I think, Honorable Minister, it was supported by the World Bank to build residential areas for people who are working at Health Center 2. There were staff quarters. I think, if I'm meant to remember, the argument that the Ministry of Health presented is that the health workers are close to the health centers so that anytime they are needed, they are present to help. I don't know how that played out and whether the impacts can be seen very closely. But let me come back to you, DHO. You've heard it from Dr. Mugahi, who understands your region very well. This morning, Dr. Mugahi, we were talking about how political leaders refused ambulances to go to another center, and the minister was a bit annoyed about it. But yeah, let me come back to you. We talked about systems, then we also talked about, I think Dr. Drury talked about behavior of people. We have increased your salaries. We have done everything possible. What do you want us to do to help you perform better? We've heard about absenteeism, which has been presented in different reports of senior medical workers. We have had people who are setting up parallel clinics and they're giving more time to their private clinics rather than to attend to patients in private facilities. What do you want us to do? What aren't we doing right? What can we do to help you facilitate you better? Even at your level. You're welcome.
Yeah, thank you, Solomon. I want to appreciate all the other presenters, Dr. Mohezi, Commissioners, Driwale, and Mugahi. I want to appreciate as a region. Why we have all these partners here and stakeholders is because of the multi-sectoral approach, that we need all arms here. Health issues, as I said again, are a myriad of events or challenges. Key to note, just as you started with, on my side first is staffing level. Staffing level is still biting. However much you add money, you have seen that Mbale referral, yes, that's having that big burden, that big number. But however much you add to that specialist the money, and he's alone, it's difficult to provide a quality service. So big on the agenda should be to improve the staffing level. And the second one is to equip the facilities. Just as Dr. Mugahi, Commissioner, said, I want to applaud still government and Ministry of Health that I, as Kapchorwa, we have benefited. The same to all the colleagues. I have 4 health center 2s that were elevated to health center 3s. And as I speak now, 2 of them have received thoroughly enough equipment. So this is a big applause. Now the challenge comes here that you have a very good infrastructure, but you have very limited staffing level. And someone somewhere has just refused or declined to approve recruitment. So this is where the game changer comes in. However, I want to appreciate that, yes, the announcement was done in good faith, though others in between are still requesting, but we are saying no, let's have a commensurate service. This now turns back to the DHO, the COW, and the local leaders invited here. What are these staffs that you currently have providing to the community? An example, if you ask it here, we are just, I think, 3 months to 4 months to have operationalized Kasarem Health Center 4, which was upgraded 1st July last financial year. But there are districts with the health center force to date not functioning for over 10 years, 4 years. So this is where the leadership and governance comes in as a challenge. Can we go back and draw our own strategies? There are those that are local strategies, and there are those which are general. Staff attendance to duties, which you rush to, I wanted to put it last. Reason is, these are manageable people. For us in Kapchorwa, we had a very low staff attendance to duty and absenteeism. The key to that was during performance review, we ranked facilities and staffing. And we agreed with the stakeholders that LOC 3, sub-county chief, GISO, health unit management, supports the entire district team in supervising the lower facilities. Otherwise, you will get a sub-county. I'm very sure Dr. Mugai and team bears me. The health center 3 might be in the same compound with the health center, with the sub-county. But they are waiting for a DHO to come and monitor and say, so-and-so is absent. So for us, we took that, and for the past 2 financial years, I want to assure you, our attendance to duty has improved, and the quality of care has changed. Let's all work. Let's all be on our duties, and let's all support the system. When I talk about multisectoral, for us in this region, Solomon, you may have not explored to Wanale, to Buduta, Namsindwa, Kapchorwa, and Buku. The terrain topography is terrible. So when these constructions are done, infrastructure are done, they are localizing it to a health center 3. Access is a problem to some of the community members. What am I saying here? When you allocate facilities per sub-counties, just as I had somewhere, per sub-counties, it is a challenge. So the people to plan better are the local administrators and managers. You get a sub-county running in 2 terrain or cliff levels, but that is one sub-county. So if you put a facility down there, how will these others access? But at the ministry, they are telling you, no, this is a sub-county, and this is a health center 3 for this sub-county. So for me, issues of distance, issues of population, let it be customized to improve access to some of this infrastructural development. The last one, I don't want to have a lot of time. I'm going on top-notch issues. Community education is very low. Honorable Minister, why I started with the health promotion and disease prevention, it comes back to what I'm mentioning. It is still low, and we must explore all the avenues to improve community knowledge on health seeking and behavioral, the one you are talking about behavior. Reason is that we have all these antenatal services Dr. Mugai is talking about. We have the nutrition, you have immunization, you have treatment, as we are talking about. But someone up to today tells you, I need a prayer. Someone tells you, my baby, my pregnancy should not be seen until it is visible. You get it? So this is lack of information. So much as we are putting infrastructure, we are adding salaries, we are putting 1 billion for the roads to improve access. There is something that the health sector and other arms, partners, community development should do to improve the community understanding of access and utilization of health services. Reason I'm giving this, Solomon, is that, yes, a mother comes first ANC when she's in labor. Now, what do you expect? If it's a breech, she's gravita 13, meaning the uterus is too weak, she can easily rupture, and she's on the upper belt, the roads are not accessible. So I want to say information is power. And it's the reason I'm still urging my colleague DHOs. We have these structures, Honorable Minister, the district health educators, the health assistants. You know, that is within our docket. The ADHOs, the environment officers, and coupled with the community development arm, plus the partners that we have. I want to say for Kapchorwa, we have employed that. Currently, as I speak, we used to have deliveries, institutional deliveries, at 68. It moved up to 80, now we are at 92%. And I want to applaud partners because somewhere, somehow, to improve the capacity of these people to go and implement what you want, you need to bring them somewhere and engage. So UHA, right, SPCA, and other partners around Baylor, thank you so much for supporting us. The same should be cascaded to others. Right. So there is a lot.
All right.
When it comes to equipment, like you said, Mbale, yes, it is all about priority. The ministry cannot do everything for us. But as we plan as a unit, as a department, prioritize. For us, we have to get a niche, a mini niche. But we had to prioritize when RBF was there, when other intra-health and rights came, they bought for us oxygen cylinders, oxygen concentrators, incubators. But as we speak now, we're able to host not less than 9 to 10 newborns. And that has reduced a big, significant perinatal death in the region. So sometimes some things we may not wait minutes to do everything, but we have been given through the decentralization system to prioritize. For staffing, that's the animal. I've said, let's use all the other arms to support us, but we also adopt the biometric machines.
Okay, and speaking of, thank you very much. Ladies and gentlemen, Dr. Masai here. Can we love on him? Thank you. Thank you for your submission. Let me bring in Dr. Drali here. Looks like the medical workers here know the problem. DHO here said we are struggling with staffing. You want us to come and work every day from 8 to 6, sometimes to 10. We try our best as medical workers. We are lone staff. Meanwhile, Dr. Droali, you've come up with systems to tighten. I mean, I've heard Dr. Masai talking about, cloaking, the biometric cloaking system at medical workers. Absolutely great. Humans can beat systems. Humans can beat systems. Sometimes they say systems are built to be beaten. But I want to believe that they also can play a very critical role in enhancing service delivery. Let's face the elephant in the room. Staffing. What is the problem? And what can we do to ensure that this problem is sorted? The Honorable Minister came here and said earlier, we are not only going to cry, we are going to find solutions to the problems. Staffing has been one of it. What is going on?
When I started service, I used to complain endlessly because of staffing. But as I got older in service, then I understood some of the constraints which limit you even as a health sector. I got to learn that there's something called the fiscal space. The money available to the state to spend must be backed by volumes of trade. So once the money available for spending in that year is decided, then it is shared with all the other ministries. And indeed, we have a constrained fiscal space that limits how much money can be put in the health sector. As the minister said in the morning, that we are not getting enough money for the health sector, because that comes from the fiscal space side of things. And the answer lies with URA The answer lies with the bigger economy. Now, out of that, what can be dedicated for wages is also limited. Just like what is given for roads is limited, what is for water is limited, what is for medicines is limited. So what is for human resources, for health, is also limited. So there is some reality with which we live. Having said that, the Ministry of Health will continue to advocate for more resources to be put in the health sector, and I said that is the minister's crusade. But for us at management level, ours is to do more with what we have. That is it. So if you are a healthcare manager, once you are given your indicative planning figure, don't now engage yourself in the debate, the money is not enough. No, that's not the time. For you, what you say is, what can I do more with what I have? Can I do more with less? And as a manager, that's what we manage. Now, let me explain this once again. If you want to improve efficiency or the productivity of the staff you already have, the solution in it is the efficacy of leadership of our healthcare institutions. Efficacy of our healthcare institutions is what will bring in efficiency. Let me explain this. Every manager divides his staff into 4. There are staff who are competent and who are committed. They know what to do and they are willing to do it. You only delegate them. There are staff who are committed, but they are not competent. They come early, they want to do cesarean section, but they don't know how to do it. This kind of staff, the kind of help he needs coaching. There is another group of staff. They are competent, but not committed. These are the staff who always lead strikes. Those ones, they need to be supported. They needed to be given more reason to do what they are doing. They are the last group. They are not committed. They are not competent. Those ones, you direct them. By 8 o'clock, I want you here. You must mop from here up to that corner. Is that okay? Now, this is where our leadership fails. Once you are a timid leader and you do not categorize your staff and push them like that, tactfully, you can use sweet approaches to do what I'm saying here. The problem is now leadership. Now, when you see the regional referral hospitals trying to provide regional leadership, I'm on sick leave. I just came because this is what is going to transform the health sector. The leadership, you see, there is no DHO who wants his statistics to be the worst in this region. And it will put all of them on the edge. That is leadership. So you bring them here, you do peer review, you set some silent competition. And for me, this is a core of human resource development. So you up your skills. So leadership of healthcare institutions, the health system, if you are a DHO, you are the person who is responsible for the lives of people there. It will be sad to see you complaining in a district meeting because the whole population is relying on you for answers. By the way, I'm a former DHO, so actually I'm talking what I know. and my brother Mugahi and JB. So, if you are a DHO, there is a reality in which you will have to work. You have the leaders. You may have your master's, you may have a PhD. If the Secretary for Health, like my Secretary for Health was a senior 2 leaver, someone who was in the army, my responsibility was to educate him to understand what I'm doing. And it helped me resolve conflicts. But if you are keeping the district budget here, what are you attracting? Curiosity. Our instructions are clear that once you receive money, put it on the table, stick it on the wall, and you are keeping it in your laptop. You are creating curiosity, and people are going to attack you. And this is management.
Yeah.
So, Serwanja, in summary, to influence the behavior of actors in the health system, leadership must now become the thing. And mine is to encourage the different healthcare leaders, whether you are nursing leader, medical leader, public health, administration. This is now the last lap. Now can I add one more thing? One.
Yes.
The last thing I want to add, when people are outside, issues of absenteeism and so on, these absenteeism issues, this is a well-known, very established human behavior. Humans think marginally. Once you are improved, paid your salary, the tendency to do something to get more money is only natural. Right? The economic model of human behavior states like that. So for that matter, management, again, does not need to pick sticks to run after people, but put in place things which will motivate the workers to prefer working in this area. So the question for management is, what are these things? And we can engage on that at a later time. Thank you very much.
Dr. Durali, thank you very much. I am told our time is fast spent, so for the two panelists, I'll give you 1 minute each, and then I'll give the Honorable Minister an opportunity to speak back to the panel, maybe 2 people, and then we break for lunch. Dr. Augustine, what can we do better in 1 minute, and then I can go to Mugahi. You're welcome.
Yeah, thank you very much, Solomon. As my colleague has mentioned, we need to be more efficient because resources are limited. We need to be very, very efficient. And as Uganda Health Activity, amidst the ban on recruitment, etc., if you happen to get that approval from public service, as a project, we are ready to support the recruitment process. Advertisement, logistics for the Health District Service Commission, etc. We are available to do that. And lastly, we need to shift focus to primary health care, which was emphasized by my colleague. Thank you very much.
Thank you very much, Dr. Augustine. Dr. Richard.
Thank you so much once again. Not for fear of repeating what Augustine, I think he was reading my notes. I think we need to also to be more aligned. We need to be more aligned. We have all, Uganda is saying that we have the best documents. So the alignment has been done. So we stick to something and follow through it 360. If something works, we all practice that like a rosary. We stick to that until we get to where we want to go. Number 2, on efficient, we need to be efficient. I entirely agree 100%. But efficiency, from my side, is that we invest where we get the highest returns. I've just mentioned that investing in primary health facilities, health center 3s and 4s, gives us the highest return. Let's do that as a country. So I think for me, and then probably be better coordinated. There's so much resources.
An opportunity to speak back on any of the issues that have been raised. Do we have a microphone? Any microphone? We could extend it. Okay. The Honorable Minister has just said thank you very much. I will give an opportunity to 2 more people to give their feedback. I'll start with Dr. Watiti. I can see so many hands. Okay, 3. Yes, sir, and you, sir. Any lady, please. I will be queued. I will pick a lady from that side. Any ladies in the house? Okay, even you, ma'am. But make it quick. 2 minutes each. Do we have a microphone? Someone, please hurry. We'll get feedback and then we will see what we're going to make. Dr. Watiti first and then we can have him. You're welcome.
Thank you very much, and thank you very much for this. I really have absorbed and will follow up. My name, as you've been told, Dr. Watita, and I'm the board chair from Mbale Regional Referral Hospital. And I get calls almost every week, sometimes every day. People asking whether they've gone to hospital and they have not been helped. So the first question I ask them is, who referred you? And nobody is referred, actually. Then I went to my namesake, Dr. Obo, asked him, do we have a referral system? And the question is supposed to be there, but so the question which I want, is there a referral system maybe which our friend can help us to improve so that we work on this? Because a referral hospital where almost everybody is on self-referral, I don't think this is working.
Wow. Do we have a referral system? We'll speak to that. Yes, Karibu.
Thank you, MC. The first thing I would start with is to request that you give me just about 5 minutes. Just because I'm not talking as Dr. Ngobi, but I'm talking as the Office of the Prime Minister, and which is the key or the coordinating entity, deed of government business. And I don't know whether my request is accepted.
I'll give you 3.
Thank you so much. Let me start by, John Ruth is not here. I really like John Ruth's composure. However much the problem is burning, if you look at her body, she relaxes everything. But again, if you listen to her words, however heavy you have the hammer, you cannot mend her words. They are very piercing, and that's what she means. I love that. I just wish I developed that. But for us, sometimes when you are developing a point, you even frown your face to show that you are serious. I bring you greetings from the Office of the Prime Minister. And it is very good, really. Let me thank all the participants who have come, the partners who are here, and of course, the government. But as it is, as the practice is, my family has never thanked government for providing. It always thanks me because it is me giving the money direct. That's why the whole house is thanking partners. But partners should also thank government for creating a space that is enabling them to provide what they are providing. But I thank you, partners. I served in different capacities in the health system. Dr. Oz and my colleagues here. During our game, it was Dr. Mugahi who is leading the district league table. Me, I was in some of the disadvantaged districts, Kavramaido, Nakasongola. And then I went to Mubende and I handed over to my colleague, Dr. Nkurunziza, the Regional Referral Hospital. And I retired, but again, I'm not tired. I'm serving. But during that time when I was serving, I was more on the demand side. The demand side, everything complaining, this one is not adequate, this one is not adequate, this one, government do this. But when I crossed a bit and became intermediate, and now that I'm more in the political wing, I now knew that the supply side has its roles and the demand side also has its roles. Now, when we ask ourselves as the demand side, this whole house is like the demand side, including me. They are all demanding for quality health services. But if you ask them, what is your effort to ensure that you are getting quality health services? What is it? How many times do you visit a health facility to see what Dr. Bo and team are going through and what solutions are you bringing on board to ensure that you work together? Nothing. In fact, what you will say is, I want my ambulance parked there. But you are demanding for quality services. Why are you parking the ambulance and not letting it mobile to collect people here and there? So what am I saying is that in any services, if you want to improve it, we must all participate. These health workers are technical people, but the facilitation comes from all of you. And now that you've just launched the community engagement, because for us, I work from the Prime Minister's delivery unit, and we've just gotten a directive from the President because he saw many numbers still in OPD. And he asked the question, despite the interventions government is putting in place, why are there still many cases in OPD? So the community engagement is a key strategy for preventive services, and that one will be driven by all of us, especially the district leaders. That is one thing. And of course, information sharing is very key. We used to have barazas, local community engagements, to pass on the messages, to show the challenges, and even come up with solutions. I don't know where those things are going to. They died a natural death. So barazas should come on board, and solutions should come not only from the supply side as government, but from all of us at all levels. Everyone has a role to play in improving services. And I'm very happy that at least this thing has come on board. And more so, we are harnessing partnership to build systems. That is very key. And this is just my request from partners as I wind up, that we are coming up with partner rationalization. Last Tuesday, we had a meeting with most partners at the office of the Prime Minister. And you find that some partners come with predetermined issues. But we need to create a situation where partner district need-led needs are addressed. Let the district come up with their needs and partners address. Like my colleague, Augustine, has put it very well, that they are looking at the challenges in the district and trying to address them. Otherwise, let me not stand so much amidst your lunch. I thank you so much, but finally, leadership and governance is key in all this. Support supervision. We created biometric machines. We gave biometric machines. But as you said that they are beaten by systems, these health workers killed them. You killed them, and yet you are demanding again for more. But how many districts have labored to know that these things have really worked for us, and now we should procure more? I thank you.
All right, thank you very much. Doc, yes, sir. There's a gentleman here, and then the lady. 1 minute, please, each. Then we can
Thank
conclude.
you. Stephen Wasike Mogeni. I'm the district chairperson of Busia. And I'm going to talk into the law because I was a member of the parliament in the 8th parliament. This issue of clearances and public service ministry taking over the role of public service commission. When you look at Article 166, Clause 1C, it says, the functions of Public Service Commission, except as otherwise provided in this Constitution, the functions of Public Service Commission shall include
to review the terms and conditions of service, standing orders, training and qualification of public officers, and matters connected with personnel management and development of the public service, and make recommendation on them to government. Now, what is happening now is Ministry of Public Service has usurped that power. And it is not even the minister. It says it is only the minister who can issue. So I asked them, which minister was this? So they used annual clearance and distort the whole recruitment plan. Like in Busia, we had 793 million on our budget. And we wanted to recruit. One health center called Namasolo has one staff. One, like this, a whole health center, 3. One staff. Sukuda has 3 staff. A whole center, 3. Bumba has 4. Bumunji has 5 out of 19. It's so pathetic. We got the money. The clearance was denied. And that is why I picked interest. How can you deny us clearance? And then they were referring to annual requirements, what and what. So I picked interest in the law, which law they were using. And that's when I discovered this. So somebody is breaking the law and punishing us, even when we have the wage. And at the end of this year, 1.6 billion has gone back. 1.6 billion. I have the evidence. The bigger part of it is health money. Reason, no clearance. You go there, play stories. Oh, you see, we are still doing the analysis. So that is number 1. Number 2, drivers of the disease burden. Right now, and even last week, I was battling with my sister who is suffering from cancer. I went to our hospital. We were referred to Mulago. And then, of course, the fuel and the system, like my brother was talking, has broken down. There was no fuel. We had to use others. Much as they have picked 5 million for fuel. So the system and the drivers, what is the burden we are battling with now? These are non-communicable diseases. Cancer, diabetes, ulcers, pressure. Our focus should be there because this is what is killing our people. My sister has survived all the others, including giving birth to 80 children. She's 64. But now this is what I'm struggling with. So what are the drivers of these non-communicable diseases? The ones which are killing our people. And lastly, on motivation. I want to agree with my brother. You see, professor, I think when we were in university and somebody would present something new and very, very unique, we used to give him the title, just professor. So whether you're a professor or not, allow me give you that title. On those competent and committed and ignorant, competent but not committed and not competent. I want that one was really very beautiful. And I'm wondering whether most of my staff are not in the last 2. And therefore we must use a different approach. That's what I'm wondering. Thank you.
Thank you very much. There's a lady there before you take the mic. And then, and then we come back. Guys, I'm standing between you and your lunch. Please, Karibu, you're welcome, ma'am.
Thank you, MC. The panelists, ladies and gentlemen, I'm retired ASP at Haiti Hope. As another DC and Mbale Regional Whip, our roles are to make sure we follow government programs and service delivery. When it comes to health sector, I'm seeing something that we need to really be brought on board. When they say that, for instance, there are no personnel, I want to appreciate that. Probably no logistics. I want to appreciate that. But here we have a facility, like in Queen, specific, where you have a health facility as a health center 3, well built with everything in there, and we have like 3 maternity, they call them what? Midwives. But you find one is working for 5 consecutive days. There's one person. Can I also borrow chairman's word? Do we also have in our area categories, the last category? Because there is accommodation. We have medicine. We have whatever it takes, but people are not available. And you find a day, sometimes there's a padlock. You can't find it. They say, no, you see, some of them are on call. Call meaning they will call you wherever you are to come. But the askari is not there. The in charge is not there. The midwife is not there. And the dog is just, you find the dog loitering around. Where do we place this? How do we bring out service delivery to these people? In our neighbor, Ramburi, a lady was just going delivering on a veranda because the place was locked. Do we keep quiet? Should everybody keep quiet and not complain? Which categories do we have? Are the leaders in that category or the workers in that category? Can we have a way forward? I will always bring this one up. I reached a health facility in Queen, midday. The place was locked. Padlock, not only just putting like this. Until 3:30, I got a first person. Constant calling the DHO. The person who came had not even, was on leave. I said, when did you start leave? He said he's not sure. So how did you go? The file is still at the district. So when I'm supposed to come back, still she doesn't know. The in charge. Now, no one. Does the RDC in this category keep quiet? What do we do? What do we need? So do we go and arrest the DHO? Because he's now the head, management. Can we have that? Can people, if there's motivation, we have seen the motivation, the salary is there is accommodation, there is what? What the hell can a person come and die in the hospital when the place is closed? What do we do?
All right. What do we do? Let me ask that question back to my panelists, after which we will go for lunch. I'm sorry, guys. There's so many arms, but it is 2:30. I'll give a minute to each of my panelists to make a response to that, and then we will break for lunch. Let me start with Richard. Let me start with you, with Dr. Mugahi. Your response.
The answer, it's a hard one. But the answer is in the words that Dr. Masai mentioned, that the delivery of health services should not only be carried by the DHO. So routinely, there should be engagements. Something similar to this can be replicated at district level, so that the RDC is brought on board, the LC5 is brought on board, and all the other stakeholders. I like taking administrative actions. Might be arresting may not be the immediate answer. I have seen arrests making the health system that's weaker collapse completely. Even including this area, even now as we talk, I've been battling with something from IGG. There's an IGG group that's arresting everyone. So I really think we need to sit and contextualize the problem. I like the comments from Chairman Busia, and that was part of my opening statements. What do we do with wage? And Chairman, just go to challenge it legally. I think. Let's come here out with a resolution that you challenge that position legally. Thank you. There's absolutely no reason why you should have money and you're denied to recruit. Thank you.
All right, thank you very much. Dr. Druali, you're welcome to make a response. Also on the referral system, I think you can also address Dr. Watiti's question, but you're welcome.
Right. Yeah, thank you, Mr. Wanja. The Chairman Busia has articulated the illegality of the approval process. I was not aware of that. So I think either as an individual or through Olga, you can petition, you can challenge this. Since you are a paralegal, you can find the best avenue to handle this. By the way, taking things to court is not necessarily negative. Some systems wake up because you have challenged them, and you challenge them legally. So I think that's the right route for you to take. Now, I may not be in a best position to explain the disease trends. The director of Mbale is a specialist in that area. He probably would step in and explain the changing disease pattern. But what one can also say clearly, the disease pattern is expected to change with the changing demographics. Ugandans are living longer. The diseases of old age are going to begin appearing, and cancers are one of them. By the time in the 90s, if you reached 45, it means you are an old man. But today, even if you are 55, you are not that old, because the average length of stay has gone to close to 70 now. So as we get more and more older people, you will begin to see diseases of that nature appearing. So it means it will change the entire profile of our diseases, and also what is expected to be done. The responsiveness of the health system will have to change, because it is not going to be about diarrhea now, it's not about measles now, it's not about pneumonia now, it is not going to be about malaria, but it's going to be about chronic, expensive, lifelong diseases which are very expensive to treat, and that is the task for the Generation Z. You will have to look after us. A new health system will be required for that. It will have to be redesigned to respond to the new disease challenges. So this is not a very small problem. We're just at the beginning of it, Chairman, unfortunately. Now, about the referral system, in Uganda, we do not do gatekeeping the way it is supposed to be. If you go to UK health system, when you go to one surgery and they have fixed for you an appointment for Thursday, my brother, you will not get another treatment in any health facility in that country. Because when you go, they will say, hey, you are coming here, they booked you for Thursday, what's your problem? Nobody is going to attend to you because they do gatekeeping. In Uganda, this is not the case. Someone goes to health center A, he was expecting injection. He was given tablet, he goes to B to re-describe his disease in order to induce an injection. So it's until we fix the functionality and put in place the controls, we will be running. We did a study, Serwanja. Ugandans are complaining because of medicines shortage. Our study showed 40% of households were hoarding medicine. Even you people here, when we go to your homes, there are unfinished medicines in your cupboard, in your bag, or on your table. And that is a privilege, and it's not benefiting anybody. So we are not gatekeeping our health system, so the referral system will not work the way it should. And we're crowding the health center, a very expensively trained and paid consultant will be treating something which can be comfortably treated in a health center 3. These are the efficiencies we're talking about. So, but to fix it, you don't start by chasing people from the regional referral hospital. You first of all pay attention to what are the lower level health facility architecture in the city, in the region. So that goes back to what Mugahi was saying. You fix it down and then come upwards. I want to end on organized absenteeism. Organized absenteeism is where health workers or healthcare managers tactfully organize duty rosters in a way that it gives them less time at duty place. I went to one hospital near the Nile. I don't want to give the name. It's not Ginger. In that hospital, there are 7 doctors. None of them has a ward. None of them is on duty. And all of them are on call. Only one is on call. So what does that mean? The wards belong with the patients to the nurses. So the nurses do the ward round, then they call the doctor. Hey, there's a patient, come and review. So he comes and looks at it through a pinhole and goes away. That behavior is unacceptable. I don't think Ugandans are complaining that our salary increased. They want it reduced. No. I think there are some expectations of quality which we're not meeting. Now, this becomes the next task for managers now. How do you ensure that this expectation is met? So you have to start by organization of your teams. The medical in charge of a ward is a leader. How does he lead the medical team in that area? So it boils down to organization, it boils to management of people, management of resources, and supervision. Solomon, I went to Nakaseke. This one it was a good story, so I can bring the name. In Nakaseke, the immunization coverage was very low. Then we started interrogating why. It boiled down to the point that children are not being vaccinated every day. Why? Staff were not available. Why? The duty roster, which was pinned there, was that the staff go work for 2 weeks. They go 2 weeks off. So it means they work for half month, technically speaking. And then 2 weeks off. Now, this constrains the system in a way you can't believe it. So when we discussed this matter, the sub-county chiefs were there, the councillors were there, the cow was there. One of the nurses stood up. The lady told the meeting, since I came here, I found the duty rosters were designed that way. For me now, I know we're supposed to work for 2 weeks and rest for 2 weeks. That is organizational culture. Now let me quote for you and end there. Organizational culture, it's a strategy for breakfast. If you have a wrong organizational culture, how beautiful your strategy for doing work, it will never deliver. So what we are dealing with is a wrong organizational culture which we must fix as professionals. And I've already started getting engagement with my team where a district invites us. We sit down and we have a conversation and come up with the practical way of how we organize the service and see how it improves. It requires conviction that there is a problem and it requires a solution. So thank you very much. I end there.
Wow. A poor organizational structure, its strategy for breakfast.
Yeah.
That is deep. Thank you, Doctor, for your thoughts. Yes, Karibu, please.
So I have one question before I make my comment. Do we have absenteeism in Elgon Hospital or St. Anthony Hospital in Tororo? Do we have absenteeism? No, zero. So we are dealing with a design issue here. Each system is designed to produce what is meant to produce. And one scholar defined insanity as doing the same things again and again and expecting different results. It's like a husband bringing beans every day expecting to be served meat. That is insanity. So we need to design the system. Why can't we have contracts for all healthcare workers? I know ministry has developed key performance indicators for certain cadres. That's the right step in the right direction. Where you work, all of us have contracts for 1 year. You bring your nonsense, your contract is not going to be renewed. Why can't we amend our laws and allow the RDC to instantly sack people who belong to the last two categories? I rest my case. Thank you.
I have heard people saying, no. Okay. You're very welcome. Dr. Masai, you have the final say. Please.
Thank you. I want to appreciate everyone. And
all right, ladies. Ladies, come back to me. Thank you very much.
Okay, thank you, Solomon. A lot has been said. And take-home message just is to remind my colleague DHOs, ADHOs, and request our supervisors, COWs, that there are issues here. And there are those low-hanging things that we can easily address. That's absenteeism. Organized absenteeism, I want to say, it has been part of our discussion during our monitoring and supervision, but I've said it all takes the leadership, where the managers commits in spot checks, monitoring and supervision. You see, Solomon, the support supervisions we do generally are routine. It's almost quarterly. So if you are going to be a DHO and you, with your team, and you master that we must go for support supervision, they will master your routine. So there are small things that we need to do, just like the RDC Queen decided to go to a facility and got that it was locked at midday. So that's a practice. We have the vehicles, sometimes no fuel, but I want to applaud our partner UHA. They have come handy, supporting us with some fuel, depending on how you put your concept. We also have our fuel and the PHC. So that one, I wanted to colleague DHOs that we address it here. That going forward, issues of absenteeism should not be an icon to be discussed during the Health Assembly. We should be discussing how do we redesign, re-strategize to moving the health demographics that they have just talked about. So I want to commit on behalf of my colleagues that for me, yes, it's not yet 100%, but it's working by involving the sub-county chiefs, involving the GSOs, and involving LOC3, involving the chairperson, UMIC. Why is it there? And the parish chiefs. Now, I wanted to move a little to the referral system. Referral system, our audience will never be addressed if there is still absenteeism. There is no way you are going to stop me with my patient or client from reaching Mbale referral or reaching a general hospital like Palisa, Kapchoro, Obududa, and Tororo. Reason, I need the service. But where you expect me to be, it's locked. Where you expect me to go, the doctor is not there. So it comes back to us, the managers and leaders, to addressing the absenteeism component. Let the issues of supplies be the game, which I wanted to request that maybe Dr. JB and Dr. Mugahi, Commissioner Druale and Mugahi, we address the issue of supplies with NMS. We have had a lot of erratic delivery of supplies. What NMS does is very good. By end of year, you will have received all your supplies, and there is no way you will demand them your money. However, I'm supposed to receive bi-monthly. Unfortunately, I receive after 4 to 5 months. The mother who should have received that glove, received the other supplies and medicines, already died. Yes, because she didn't have the supplies, I don't have. And what happens? Maternal death or perinatal death. But you give me after 3 to 6 months. I will have it, and that brings what Commissioner Druale was talking about. People hoarding drugs because they anticipate future sickness and stockouts. So I wanted a request on behalf of the DHOs and the health system in the region that please let, however little they are, let it be regular and periodic as they are supposed to be. Then the last one is on our system, Solomon. In Kapchorwa, we used to have the RBF, result-based financing. And here, there were some incentives that were given to people who come for service, to people who provide the service, the health workers and the others. However, that part was removed when this money was added. So there is no way I can add some incentives to you when already your salary has been improved. However, for us as a district, we realized that during that time, the TBS, the traditional birth attendants, were a game changer in improving our facility deliveries. And through the same discussions, which I talked about, we codenamed them traditional birth referral agents. And we ensure that these FATs or the TBS are given some incentive by end of year. Because if this mother is not referred by them, then they pay them something. Can win them on the other side, utilize the PHC and other funds. So I was giving that the referral system can never work if there's still absenteeism at the low facilities, health center for and general hospital. People will flock and burden the regional referral. The other one is improving the community structures and embracing them, utilizing them to serve the health structure. Thank you.
All right, thank you very much. A round of applause for my panel, Dr. Alfred Druale, Dr. Richard Mugahi, Dr. Augustine Muwezi, and Dr. Masai Siraj. Very soon you'll also call me Dr. Solomon Serwanja. I'm finishing my PhD in 2016, so hopefully I'll also be, 2026, sorry. I hope that I will also be befitting to be called doctor at this time. Thank you very much. A round of applause to all of you who have been listening in quite closely and contributing. Clap for yourselves. This is one of a lively audience I have hosted in recent times. So thank you very much. Lunch is ready. It's going to be served. We all are all going to return here after lunch. We have different breakaway sessions. All of us after lunch will be here. If you've received coupons, there are 2 restaurants where they're going to be serving from. There's the Cafe Barista restaurant on your left as you go out, and then there's the Terrace Garden restaurant. Those with light yellow, you'll go to Cafe, light yellow coupons, you'll go to Cafe Barista, and those with white cards, you go to the Terrace and Garden Restaurant. Thank you very much. Let's clap for our panelists. I'm Solomon Serwanja, and I'll see you after lunch. All right. Enjoy your lunch, and I'll see you shortly. You Bagambi. And very wonderful conversations. Welcome back from your lunch. I hope that we all got an opportunity to